opportunity and to all my colleagues on the board. Before I get started, I'm going to take the opportunity to read something. Good afternoon, and thank you to the Department of Human Services, the entire team for being here today and for the work you do every day to support some of the most vulnerable members of our community. As many of you know, Human Services has been a priority, not only of myself, but for a lot of members on this board for many years. But it's really the true effort of this entire team. I want to take an opportunity and recognize our chair, Matt DeFerranti, Vice Chair Maureen Coffey, Board Chairs Susan Cunningham and Takis Karantonis for their consistent leadership and commitment to this space. Together, we share the responsibility of protecting and strengthening the social safety net of our community, and DHS, my friends, sit at the center of this mission. DHS manages one of the county's largest and most complex budgets, overseeing more than 100 programs that serve residents across the lifespan, from youth and families to seniors, individuals experiencing homelessness, and people with disabilities. At the same time, the department is operating in a period of significant uncertainty. Demand for services is shifting, administrative requirements are increasing, and the federal and state funding streams may face real pressure. Today's budget discussion is an important opportunity for us to better understand how the department is prioritizing resources, measuring outcomes, and preparing for potential fiscal and operational risks. With that, I'll now turn it over to the county manager to begin the presentation. County manager.
Ladies and gentlemen, Anita Friedman.
That was quick.
I won't tell you what he really calls me, but
Isn't there like a walk-on song or anything?
yeah. Good afternoon, everyone. On this crazy snowy afternoon where it was 80 degrees yesterday and snowing today, and it feels like it's budget season. We don't know what's coming. And I just wanted to offer my greetings to the county board and their thanks to my superiors here, my supervisors, the county manager, Mark Schwartz, and the deputy county manager, Michelle Cowan. And I'd like to take a moment, if it's okay, to announce, to introduce some of our leadership team. Of course, I'm accompanied here by Deborah Warren, who's the deputy director for clinical services and the CSB executive director. Glenda Pittman, who's the Deputy Director for Operations, Corey Travis, with whom I would not be able to produce this budget, Finance and Information Systems Division Director. We have Tabitha Kelly back there, who is the Child and Family Services Division Director, Carol Layer, who is the Behavioral Health Division Director, Robert Sharp, our new Public Health Division Director. Who else am I missing? Dr. Parrish, Public Health Director, Maimuna Ba, Aging and Disability Services Director, three deputies, three assistant directors, Caitlin Hutchison, Candace Lopez, I don't think is here, and Destiny Esper, our new Communications Director. Ollie Russell. Linda Erskine. Who else? Ramona. Rachel Coates, no, I already LaVoice Reed. Oh, and Michael Dharma Irwin, Quality Insurance Division Director. And Jim Baker, who deserted us. But it's okay, he's still contributing to the county. And Brooke Hammond Perez, who's somewhere in an airport getting on a plane to España. So, good for her, right? Well, this year has been really my most challenging year in 18 years at the Department of Human Services. And that is because we are confronted by a national landscape that has proposed changes to our regulations for safety net programs, regulations which are still not exactly clear and have put many low-income Arlingtonians at risk of losing benefits related to health, food, and housing. And the risk is also for our nonprofit partners who are represented here. I'm also keenly aware of the fiscal challenges in the county and the need to curtail discretionary spending, which we are carefully monitoring, and to continue to evaluate all of our programs for efficiency and effectiveness. But I am very grateful to the board and to the county manager for the support that you all have provided to our Department of Human Services, leaving most of the programs well positioned to carry on through these upcoming uncertainties. Arlington is not immune from any of these national or state issues that we face. housing affordability, food insecurity, increase in homelessness, rise in mental health crises. We are simply smaller. We are a microcosm of the national environment. But we have the privilege that we are in a community with a very progressive local government, innovative and dedicated human services staff, and the ability to leverage strong partnerships that have allowed us to navigate through these challenges while attempting to keep our community alive. So let me start by going to the next slide. Okay. A brief overview. I'm sorry, some of these boxes are really chock full of data, and I hope you have an electronic version in front of you. We are the largest county. We are the largest department in the county, and as Mr. Spain mentioned, we provide human services from prenatal to end of life for about 50,000 residents in Arlington. That's a significant number. We do that through the divisions managed by the leadership, 5 that are customer-facing, 2 that are administrative in nature. And we have grown to 817 staff and a proposed budget in fiscal year 27, of $213 million. You can see in some of the orange boxes the numbers of folks that are receiving services in different programs. The most telling is how many people walk into the Department of Human Services. That is up 15% since last year and has reached 53,038. That's not to mention those who call or do things online, but we have, our numbers keep growing. Medicaid, of course, is the largest program, almost 30,000. SNAP, almost 10,000 folks. Housing grants, and we'll talk about that not today, but on the 18th. Emergency financial assistance, food assistance. Arlington is unique, and the reason we're so large, I just wanted to give a little historic tidbit. We were created in 1969 as an integrated Department of Human Services. The planners back then said, we put everything under one roof, we're small, we can integrate. It's actually a best practice model. There are very few of these across the country. But what that means then is that we are the administrators of most state and federally mandated programs. So we are the local health department, we are the local housing authority, we are the local social services agency, we are the local child welfare agency, we are the local area agency on aging, we are the local employment center, and we are the local community services board, which means there are many, many streams of revenue, regulations, and program goals and objectives coming into one combined administrative organization. Next slide. Here is some of the growth that you can see over the years. We now have our budget since 2022 increased by 33.7%. Our revenue has increased by 30%. We still receive about 27% in federal and state grants, and the adopted FTEs have increased by 11.5%. That's from 2022 to the present. Next slide. I'm glad that this is still in our budget presentations. Our department is deeply rooted in racial equity, the practice of racial equity within all our programs. As you probably remember, we changed, our department leadership and staff made the decision to change our vision, mission, and values in 2022 to center race, because we know that in every system in which our department works, and we intersect with health, with education, with housing, with employment, with the criminal legal system, to name a few, we can see that racial inequity persists. And we must focus on what is behind these barriers for our clients, who are largely Black, Indigenous, people of color, to have equitable access. So we've centered our values in racial equity, access, inclusion, authenticity, and accountability. We have next slide, we have a very active Racial Equity Advancement Partners Group That's staff-driven. That's about 50 staff who work in 4 subcommittees on community engagement, on capacity building. They develop training they develop toolkits, they develop checklists, all kinds of practices for our staff to put in place when they're carrying out their services so that we can have a lens on equity when we're delivering services and dealing with the community. And we have an equity action plan, which is being implemented, and that will be the groundwork for, hopefully next year, I'll be able to report on our community-based service delivery pilot, where we will take the services into the community. Next slide. Another thing that grounds our department, which I'm so pleased to always talk about, is our performance management planning system. Now, this started in 2009, 17 years ago, and we've been doing it ever since, growing the aspects, but basically we use the results-based accountability framework, and we measure 3 aspects to every program. How much did we do, basically outputs, how well did we do it, the quality of the services, and is anyone better off? And when possible, we ask, well, not just anyone, but tell us who are the people who are benefiting, and are they benefiting similarly across race and ethnicity or comparatively to the populations we serve. We have about 88% of all programs with a performance measurement plan. Some are small, so we don't necessarily have one, or some are new and we don't have one. But we review these at multiple levels, at the program level, at the division level, and all the way up to the leadership, where we have a quarterly data summit where we review them. Next. Oops. Here's a sample of what an output and an outcome measure looks like. And of course, all of these performance measurement plans are published annually. They're linked to the budget. So you can look them up and really nerd out if you want to. But on the left, we have an example of outputs. How many clients were served in the shelters? And here are the shelter providers sitting right there. Well, you can see over time, since this is 4 years of data, since 2022, the number of families served in emergency shelter has steadily increased, right? Going up, you see the red line, going up to 267. Rapid rehousing is a way in which we rehouse people. Permanent supportive housing is for people with disabilities. And the single shelters are always quite full. And in terms of outputs, this is just a sample to give you a flavor of what they look like. We have something called exits to permanent housing. That's the end goal. We want people to move from shelter into permanent housing, whether it be through a housing grant or some other kind of subsidy program. What do we see here in this graph? Well, in the family shelters, we have almost surpassed our goal almost every year of getting 82%, we want to get to 85% of families exiting shelter, leaving to housing. The individuals is not as high because they're usually shorter stays, and this is at 57% this year. So there we've surpassed our goal of 45% and the national average, which is 23%. So we're basically doing twice as well in exits from single shelters to housing. Next slide. Climate. We are also engaged with the Climate Action Plan. And it has been really informative and very, very interesting to learn also about how the weather impacts us and the changes in the environment. And this touches our population as well. People who are unhoused, people who are low income and can't afford air conditioning or to pay their utility beds. On a regular basis, we have emergency winter shelter space run by Path Forward, 25 additional beds November to March, and another 15 in extreme weather. This year, we had hypothermia, that's what this is called, overflow, every day of the month in all of the shelters, not just the single ones, but the family ones too. I don't know where they put them in Sullivan House, maybe in the basement, but it's, we are packed to the gills. And of course, we have robust street outreach and meal distribution. Prior to that enormous snowstorm, folks were on the street saying, get inside, we'll take you, get in the car, let's go, because it was too dangerous for people to be on the street. And this is an increasing demand. We need more space for shelters, and it's something that is in the planning stages. Also, we have cooling and heating assistance paid for by the Virginia Department of Social Services. We paid over $150,000 on behalf of households. There were about 1,500 households that applied when the bills can't be paid for heat or air conditioning. Next slide. Okay, now I'm going to get into some of the specifics of what we've been up to programmatically, and also some of the challenges that are still remaining. And I'm going to call upon Deborah Warren and Glenda and Corey to help with the presentation. First off, and Jane touched on this in her presentation, we are implementing a comprehensive cross-departmental child and youth well-being plan. It's great because it's a partnership of human services, public libraries, Parks and Rec, court services, the county manager's office, and the schools. We're all at the table, both at the leadership level and at what we call the backbone level, which is staff, boots on the ground staff. We started a community network for people to be involved in the plan. We have reached at least 200 people. We hired, Parks and Rec hired 16 ambassadors who are doing a lot of the engagement, hundreds of youth that they've already reached out to. And we are about to finish the draft vision statement. So that'll be ready by the end of this month. We have still some ways to go to look at indicators and other engagement that we want to take on, and we will have a final product by next summer, June 2027. Next slide. Okay, now I'm going to turn it over to Deborah Warren to let you know about some of our achievements in Community Services Board.
Yes, and our Community Services Board just completed its 2x2s with the county board members. So you've already heard some of these highlights. I'll go very quickly. With regard to school mental health, this program was allocated by the county board in 2023. As with all programs, it takes a while to hire the staff, get the program really fully developed. But we're at a place right now where we are seeing results. We have 5.5 FTEs working in 3 middle schools and 4 high schools. The services are provided year-round, including school breaks, which is really important for the individuals served. It's been exceptional collaboration with our APS partners, who are our hosts and who have embraced this program. To date, we've served 212 unduplicated youth, and Takas, you were asking about outcomes. We are seeing increased attendance in schools, decreased no-show for behavioral health appointments, completion of treatment, increased achievement of treatment goals, and I'm sure we'll see an impact on grades. But overall, it's been a very positive thing. And I want to point out that, in 2023, when we started discussing school mental health, we had 2 youth who fatally overdosed. And we have had no fatal overdoses of youth since then. And in fact, overall, fatal overdoses in Arlington are down 90%, thanks to the hard work of our ARI stakeholder group, which is amazing. I want to shift now to the next slide. This is a very complex area. to talk about, and it has been our priority and a focus over a 5-year with a strategic plan that we executed in a phased, thoughtful, stepwise approach in collaboration with all of our public safety partners, the police, emergency call center, fire, EMS, et cetera. And this was accelerated with our local Marcus Alert plan, which we initiated 2 years before the state had designated Arlington to pursue this. The crisis continuum of care focuses on 3 prongs: someone to call, and that is 988, which we've developed regionally over the last couple of years. And I want to point out that Arlington accounts for 14% of all Northern Virginia calls, and we're only 9% of the population. So it shows that our education efforts are working and Arlingtonians are utilizing 988. The next prong is someone to respond, and that is our behavioral health emergency services and our MOST program. So let me touch on that. For the first time in our DHS history since 1969, we are fully staffed in our emergency services department. And it's a really big deal because we were way wicked down during the pandemic. We were really struggling. And Ollie Russell, who's in the audience, had to take over, and we had to ask our other licensed clinicians to deploy to emergency services because it's a mandated service for obvious reasons. And the good thing about this is that it's reducing, as our new staff get trained, and pre-screen certified, it is reducing our reliance on PRN staff and overtime. So that will ultimately result in a savings this coming fiscal year. We're also, in line with our DHS strategic plan, shifting to more community-based evaluations, and we're getting close to half of them being, half of our clients being evaluated in the community through our emergency services. Over the last couple of years, we have developed our mobile outreach support, I should say teams, because we have 2 fully staffed teams, 2 beautiful vans that go out into the community. A change this year is we have trained them to be pre-screen certified, which means they can do evaluations for emergency custody orders and temporary detention orders in the field. The other thing we're doing is co-responding with our police partners so that the site is cleared for safety, because you never know what's behind that closed door, and individuals can get a behavioral health response when they need it. This service is available during the weekdays, 8 to 8, with overlap during our peak hours, and ultimately, our long-term goal will be to expand to 24/7, but we don't have the funding for that as yet. This program is fully funded, by the way, by our Marcus Alert funding from the Department of Behavioral Health. And another piece that's important about that, the staff have been trained to work with all populations, including youth and geriatrics. So moving on to our Crisis Intervention Center, that's our place to go. It's our 24/7 therapeutic alternative to the emergency room. And I have some exciting nuggets to share about that. First of all, it's being increasingly utilized. In the last calendar year, we served 820 individuals, and we think that number is going to go up because we now have a full-time nurse practitioner in the program and after hours, a contract for after hours psychiatric prescriber services. And that is being really well utilized. Also, just yesterday, we executed a contract with Virginia Hospital Center, our very close partner in this area, for lab services. We are effective the week after next. We will be doing medical clearance at RCIC. What does that mean for the clients? It means that when individuals are brought in for an assessment, they will not have to go to the emergency room for medical clearance which is necessary before you can be in a psychiatric bed. So that's a huge change. We also have 24-hour nursing staff and do a medical assessment on every individual that comes in. And so that is also new in the last year. I do want to point out that our data shows that only 2% of our clients come in between 11 and 7, and so the reduction of 2 clinic aides during those hours will have no impact on service delivery. And then finally, I want to mention our special conservators of the peace, because we've just completed 1 full year of successful execution. We have 2 around the clock in our CIC, and they provide a safe, secure environment that allows for transfer of custody from law enforcement when there's an emergency custody order, freeing police up to return to the street. And so far, we have completed more than 200 transfers of custody and saved over 3,000 police hours. We expect that that will grow with our medical clearance. So that's really exciting. Okay, so I have to move on.
Next slide.
Next slide. Sorry.
And Deborah, before you go, and this is for everyone, when we get to slide 14, team, I think, there's a lot of content here. I think we're going to pause and then do the first wave of questions, if y'all don't mind, once we get to slide 14, okay?
Yep, sure.
Thanks, Deborah.
So we just are excited to report that we are continuing to strengthen our work around individuals who have behavioral health issues and needs that get involved in the criminal justice system. And that's a big press in our community with our advocates, and we have been working to develop various strategies. Here is another strategy. We have a new grant that we have just been awarded where we are going to work to restore competency of individuals who are adjudicated not competent to stand trial because of their mental illness. We're going to work on that in the jail rather than sending them off to, frankly, non-existent state hospital beds. There's a huge wait list right now for state hospital beds. You'll hear about that Monday night. But this is important because it'll be faster for the court process. It'll keep clients connected to the community and their families. It'll reduce reliance on overcrowded state hospitals, and it will provide stronger continuity with treatment services. So we're going to hire 2 licensed clinicians to add to our already 17 clinicians at the jail. Aging. Thank you. Anita's keeping me on track because I have too much to talk about. I know that you all just heard on March 3rd that the aging population has increased 48%, almost 50%. And Monday, we have our Commission on Aging Engagement Forum, 9:30, Leper Run. And we are working very, very hard to, with our existing capacity, to meet these growing needs. But I am sure that we will be coming back in the years ahead to ask for some more resources to support our vulnerable seniors. One of the biggest issues is the loss of long-term beds, affordable care, with the closure of Culpeper Gardens. We are losing 73 units, assisted living units, which actually had the capacity for 146 individuals. So that's a big blow. We're partnering very closely with Culpeper Gardens on identifying what supports the individuals who choose to remain in independent living need. And you see that in our budget reduction and ask. Also, we are seeing increasing numbers. We saw 339 older adults unhoused served through our continuum of care. And as Anita alluded to, we're doing some planning because those individuals have multiple medical needs, and oftentimes VHC has individuals languishing in the hospital that really need to be discharged, and we need to figure out a transition program for them. Food insecurity, we're going to hear more about that, but I can tell you that Meals on Wheels demand for, home delivered meals is up 7%. We are seeing increased financial exploitation of older adults, which just frankly gives me the heebie-jeebies. But we saw almost $3 million of exploitation, and really working to dedicate guardianship resources and full-time APS, full court press on that. And then finally, social isolation. And now we're down to slide 14. And what I wanted to tell you about slide 14 is that over the recent years, you, the county board, have invested heavily in growing our programs for this expanding population. Most folks are not aware that it wasn't until 2017 that community services boards were tasked with being a front door for individuals on the autism spectrum. And before that, it was just limited to individuals with intellectual disabilities. That's how we were funded, and that's what the resources were dedicated to. And so now we've been working to expand resources in that area. You can see a picture of our 1212 Irving Street. That was built at a cost of over $5 million. $4 million was local funding, and it is a beautiful facility that supports 4 individuals with exceptional medical needs, 1 with exceptional behavior support needs, and multiple individuals through our respite services. Our employment access program we developed last year started off as a pilot, started off for 15 individuals. We've expanded it to 20. It needs to be permanent. That's another effort from DHS's PED to build capacity for day support, which is a big demand in our community. With regard to day support programs, we expanded last year 15 additional slots for community-based day support. This is where individuals don't go to a place necessarily, but they have activities in the community with support from Service Source. And the costs for this expansion were 100% absorbed in our existing budget. However, we have a crop pot of individuals coming out of the, crop, thank you. I'm thinking ahead,
Individuals.
We have double the number of APS graduates coming out, anticipated to come out, around 30. And so we are looking to see how we can be creative with identification of individualized community-based support slots for them. Also, we have had increased waiver slots, and this is how individuals with intellectual and developmental disabilities are able to have extensive services paid for. In the old days, we would get maybe 12 slots, 13 slots, and under Governor Youngkin, we have, through his budget, we have received 34 for fiscal year 25 and 34 for fiscal year 26. So that's a lot of individuals and a lot of services. We have added since 2018 6 support coordinators, and I'm sure at some point we're going to need more.
That's where
Okay, thank you. We have, I think, 30 some odd slots here, and this is probably around the midway point. And so what we're going to do is we're going to open up to a few questions, and I'm going to look to my colleagues, and I'm going to look to lights. I see the vice chair is here, and the chair, vice chair, and then we'll just go down as the lights come on. Question?
Awesome. I think the mobile outreach support team is one of our great triumphs, honestly, as a community. And I think adding the second van has enabled so much more coverage than what we were initially able to do. And I'm glad the goal is 24/7. Do we know how many, teams we would need to have on staff to actually reach that 24/7 goal?
Well, yes, we would have to have obviously an evening shift. We would have to have, weekend hours. Those are challenging slots to fill. I know at our jail we expanded capacity, and that's been a real challenge for us. So we don't have an exact cost calculated, but we can loop back to you on that.
Yeah, I think that's a long-term planning
long-term.
goal, but I think it would help as, an off-cycle budget question, but just for us to be able to understand how do we get there and are there maybe marginal things we can do in the next couple of budgets to not go from, the hours we have to fully 24/7, but
Yeah.
maybe somewhere in the middle and over, is it 2 years or is it 5 years? How do we chart that course?
Yeah.
And then I think,
And we will also look for alternative funding. If there's an opportunity through the Department of Behavioral Health and Developmental Services, for example, we will certainly pursue that.
awesome, great. And then I think the other question that I had also related to that slide was on the special conservators of the peace.
Yeah.
Because those are not mental health clinicians and they're also not first responders. And
Right.
can you give a little color of
Yes.
what is their background and what is their training for those roles?
Yes. So we work with a contractor who's very proud of their training. They have a whole
Yeah.
place and they do all kinds of training. We also make sure that they have CIT training, crisis intervention training, mental health first aid. They go through a very rigorous process, not just of training, but also certification through the Department of Community, DCJS, criminal justice, yeah. And they have to be certified by a judge and the police chief. So it's a multi-layered thing. Tori Madsen, our security coordinator, manages that contract, and we've been very pleased.
Okay, great.
Yeah, so they are able to deploy force if it is necessary,
Okay.
with things like restraining with handcuffs and stuff like that. But
Right.
that hasn't been a need,
Fortunately.
fortunately.
Yeah, great. Thank you so much. I'll pass along for the time.
Mr. Chair?
Thank you, Mr. Spain. Thank you for the presentation. I was looking at the employee count, and if it's school-based mental health on slide 10, sign me up. I think that's a great investment. It's important. I'm thrilled to hear about the Crisis Intervention Center's 820 plus the numbers, because we had an event, and it was very hard to get and keep the nurse practitioner, as I recall, and then creating and getting the pipeline for the special conservators of peace wasn't easy as well. So just hoping we're mindful of everything we can do to keep those people.
Yeah.
We can't really build a wall so that no one in the rest of Northern Virginia can come and try to get our folks, or in the DMV, but it's just, that's very important to me. I did have a question on slide 12 in the jail and the therapists. My sense, could be inaccurate, is that keeping staff, DHS staff serving in the jail has been challenging, and so it's plausible that you've got an additional 2 FTEs. Are we fully staffed at the moment with therapists, so we're confident we would need the 2 additional FTEs, or are there any vacancies? Keeping in mind that, it's a super hard job, and
Yeah.
and people got to take care of themselves so they can care for other people. But are we pretty much fully staffed, so we do need the 2?
Yeah, I think we have right at the moment 2 vacancies, and the challenge with those is the hours, where they're asked to work like Saturday and weekend evening hours. And so in line with a recent consultation from the Falcon Group and in partnership with the sheriff, who's just been phenomenal working with us and his new medical team, we have now co-located together at the jail. We have decided to eliminate those hours. And one of those positions, we just decided to actually, yesterday or today, decided to shift that position to do diversion, forensic diversion, more in the community. So, and these 2 individuals will really be focused on this particular population.
Great. That's helpful. The only other area of detail that I might benefit from is looking at page 584 in Culpeper, since you mentioned Culpeper.
Yeah.
There's the one-time piece of it. And then
Yeah.
some years ago, I think and I was piece of it, pushed for an ongoing increase of above 100, maybe 114,000, I don't know, or maybe 150,000, I don't know. there's a bucket of services that are worth continuing to support, of course.
Yeah.
And then there's the fiscal responsibility, given the change in the care model that is there. So I think I'm likely to best absorb this information if I ask for like a 10-minute conversation.
I can
If
tell you
could-
now, it's
Sure.
part of our presentation a little later on, if you want
Okay,
to wait for
then,
that.
Yeah, we'll do it later.
Mr. Spain, then cut me off, and I yield. Thanks.
To be careful about cutting the chair off. Board Member Cunningham.
I would love to hear how you think about cost, benefit, and return on investment for slides 10, 11, and 12. Like the work that has grown over time to have these continuum of care or, integrated into schools, integrated with our judicial system is hard and complicated and clearly is being done not because it's easy, but because it has the best return on investment. How do we measure that? How do we describe it? And what should the community know about how cool that is?
That's interesting. That was sort of what we were talking about with TACUS in terms of school mental health. We do have a performance management plan for youth outpatient services, and we are keeping data on specifically on the school mental health. I don't have that on the tip of my fingers because it's still relatively new. But as I mentioned, some of the indicators that we're looking at there. In terms of the new jail award, we are working very closely with the Department of Behavioral Health and Developmental Services because this is the first time in the state of Virginia that this program will be developed. And so we are co-creating indicators with the department. They are very anxious to serve forensic patients not in the state hospital system because of the massive overcrowding that's occurring right now. And I think in terms of the main indicator, it'll be how fast we can restore an individual to competency, how fast they will get through the court system. Do they get linked up to behavioral health treatment? Do they get served with medication? How many individuals need some kind of judicial authorization for medication over objection, which that's a long-term goal, but anyway, we will be co-creating that together. In terms of the crisis continuum of care, we are tracking all of that data very, very carefully because I'll tell you the most important indicator for me is ensuring that people get the help that they need when they need it, the most appropriate help that they need when they need it. 80% of the individuals that we see in our emergency services are released back to the community. It's only a smaller percentage that need more intensive services. And then for those individuals who need more intensive services, our goal is to, in partnership with the Virginia Hospital Center, reduce boarding in the emergency room, which is the most untherapeutic environment that you could possibly be in if you're in a psychiatric crisis. So to that end, we are really tracking with our manager of our Crisis Intervention Center, carefully tracking data in terms of all the things I talked about.
Yeah, and I would just lift up that your department has been one of the absolute leaders in creating performance measures and to trying to think about what is the benefit of the programs. And I would just encourage us to push to the next level where our taxpayers, all of our residents, anyone who comes to Arlington is one of the beneficiaries of this deep investment in human services. It creates economic resilience for us. It prevents huge costs. And we need to tell that story better because, we understand it here. And that's why even in a time of great restraint, we are investing in human services because it pays back, and so I know some of the national studies various programs are 5 to 10x, but being able to tell that story better over time, I think is gonna be very, very important, particularly as our demographics age and the services are gonna be shifting around a bit.
I totally understand what you're saying, Susan, I think, because it is very difficult in all these areas to really precisely measure unmet need.
Sure.
Especially when you're in a community like Arlington that is porous, I should say, or, very close to a large metropolitan area and people come in and out, and there's flow. So what is the N that we're trying to reach? In some cases, we don't have an N. In permanent supportive housing, many years ago, we developed a plan. We decided 425 units. That's what we were going to get. We're at 395, by the way. But what is the right number for how many shelter beds we should have? What is the right number for how many mental health therapists we should have in the schools? How many kids are going to develop mental health issues in the next? These are sort of difficult to come up with finite, so our measurements, as you're right, are more on who's coming in, what do we see, and then how can we track what has occurred over time to make sure that the outcomes for those who come in are better off. And we have, with Michael Dharma, even experimented with trying to figure out how much the unit costs of these endeavors are, and if there's any way to measure across the U.S. in any way, shape, or form what a sort of a benchmark would be. But we're still
Yeah,
at that.
and I think I know you're doing that, and I encourage you to keep pushing it, because I think it's really seeing the people you're providing services to as the ones you directly touch.
Right.
And all the rest of the community, right? And so there's a benefit on both sides, and rightly, you're considering the ones you touch and making sure that quality and continuum is there. But explaining that, especially in these tight budget years that we're going to have for the next couple of years, clarifying that what the value is, not just in our hearts, which it's great, but in our pocketbooks too, it's important.
And when we went about our 10-year plan in homelessness many years ago, we said the cost of doing nothing is not nothing.
Correct.
So a lot of these issues that we're paying out money for, without those programs, the outcomes would be higher usage of emergency room, higher usage of jails, so there's that sort of that, but it's not a direct, cause and effect.
Right. Thank you.
Mr. Board Member Karantonis.
Thank you, Mrs. Spain, and thank you for leading the session today. I really appreciate your introductory remarks. So I used to have an old professor. He was a brilliant mathematician. And as a brilliant mathematician, he was very skeptical about quantitative measurements. He was caught very often to say, you cannot measure humanity. You can measure, can you measure change? The answer was yes. Can you measure progress? And the answer, I'm not sure. The right answer was, I'm not sure I can measure progress, but I can measure change. I mean, it can measure state A and next year state B. So this is my 5th year going through this budget discussion, which is always exquisitely insightful. And I thank you already for the work and the care you put into that. If I had to put a 5-year sign on this, it's we are covering the gaps in the continuum. The idea that progress has to be the continuum, not letting anybody down, not letting any situation unattended, being aware of every step in the way, and finding out what is the problem, what could be a possible solution, what are the options. You're actually doing this work. So we know what the cardinal deliverables are, but then you find the gaps and you begin to fill. And I remember the five budgets ago, MOST was an insurmountable mountain that was, $1 million each unit, and it was difficult to articulate why this million is. And here we are today to say 2 MOST units are not nearly enough because actually we get a lot of mileage out of that, a lot of benefit. So one thing that I would like to ask you on MOST is, I'm absolutely clear today, since you also already told us that now the clinicians are pre-screen certified, that we are diverting people on site. that we are not anymore processing them into the jail, et cetera. This is huge, and I would appreciate if there are numbers on that, to have them at some point. One thing that is not unrelated to that, and you can address that in the same line. So in the budget narrative on page 663 in the jail diversion forensic case management measures, you say that the percentage of clients successfully completing ongoing programs, which in fiscal year 22 was 80%, and then it climbed up 23%, and then it fell to 52, 60, and today 65. The quality measurement on, good recidivism ratios, for example, on those who complete the programs is very good, but the number of those who complete the programs is kind of lagging. Why is that?
We could talk for 3 hours about that.
If it's a matter for a different conversation, happy to defer that.
Yeah, but I think there are a lot of variables that interfere with an individual completing those kinds of services, including court demands. There are just a lot of reasons, and I think we need a deeper dive on that.
Okay, I make a note, because I really need to understand that, because for me, diversion is absolutely critical, and this is one of the things where we have repeated requests to throw money at the problem, and this is where Ms. Cunningham's question about the return on investment comes in, because money, after all, is still money, right?
Yeah, that's also why we're shifting a position to that area from the jail.
Yeah, I kind of began to suspect that, so
Yeah.
this is why. The second thing is the two licensed clinicians in the jail, which comes in addition to the crew of social workers who are already, the DHS social workers who are already working there. In what way are they intersecting with the MOST teams?
The mobile outreach support
Yes.
tape? Yeah. That's a very good question. We haven't developed that program yet, so I can only sort of forecast. But, one of the things that we really are trying to achieve is for individuals who would typically get arrested for nuisance crimes or crimes of poverty, things like trespassing, urinating in public, those kinds of things. We are really trying to have a behavioral health response and avoid them going to getting arrested. And if they're arrested, getting them released on bond diversion. And if they end up in the jail, getting them the help that they need, because this is typically an ongoing cycle. And so with the MOST team, what we're doing is going into the community, meeting the police, and hopefully finding ways to divert those individuals so they don't end up in the jail. I don't know if that fully answers your question, but we have a lot of work to develop that program. It'll take us a year.
Interested to see now the two-pronged approach: clinicians before, out in the field, clinicians at the reception in case we haven't diverted in the field.
Exactly.
So that's, for me, intriguing and important. I have a couple of questions on senior issues
board member.
that we can wait a little bit. Just a little final thing. You are underselling yourself on climate change. Why? Because climate change affects the livelihood of people gravely. Their access to health, everything that has to do with climate justice is partially something that affects the 53,000 people who are coming to Sequoia. It's a longer conversation.
For
but
next year,
huge
we'll
one.
have an enhanced
Yeah.
presentation.
Great, thank you. Board Member Karantonis, I think to what you mentioned, Ms. Warren, we probably can talk about DHS for 8 hours. I'm just being honest, right? There's just so much to unpack here. And I just want to share a brief anecdote. because when we talk about human services, all of this matters. You may recall, Ms. Warren, back in December of last year, we had a conversation about a young individual in Arlington, name not to be disclosed, of course, but was having an issue.
Yes.
And parents were concerned. They reached out, and, you know, and a few weeks ago, this person who was, you know, going through a situation, the team showed up to the house, right? And this person finally arrived to VHC to get treatment. This is an Arlington resident, 26 years old. Doesn't matter about what side of town, but north side of the town. Parents are well off. These real stories and the impact that you're making in DHS are to be commended because you are saving lives each and every day. That being said, I just have 1 or 2 questions, and again, I think I can go 30 minutes with you, but I'm gonna be mindful because we have a hard stop here. As I look at slides on your children, the youth slide, that is slide 9. And you know I have a passion for youth.
Yes.
Don't we all? Just real quick, and you may not have this number, from a DHS space, what is the percentage of your budget, and we can get this later, is invested in youth and school partnerships, the collaborative? What percentage of your budget? The reason I'm asking that is because when we fail to invest in our youth, we have to deal with these outcomes later on down the road. And you list that you have about 200 kids in this with children and youth well-being, right?
That's the community members who have joined the network so far.
That's about 200 community members,
So
right?
far.
So far. Of, you know, out of 243,000,
That's right.
right? And I guess as we try to put people in the right place so we can get, you know, better outcomes, improve health and well-being, breaking the cycle of poverty, how do we look to recruit and bring more folks into this program to invest in our youth from a DHS lens?
Well, our goal is to engage about 5,000 Arlingtonians. That's over there, the 10% number of the youth community. And we are trying to reach out, not just with the teen ambassadors, but all public libraries invested, Parks and Rec, JDR courts, the schools. So we are, you know, in our last conversation, we were going to put things on the that daily broadcast they have inside the schools. I forget what it's called, where kids can learn about the network. These are invitations to forums and things have gone out through the libraries, social media, the Parks and Recs, newsletters. And so, you know, I think we haven't been, I think having 200 so far may seem small, but these are pretty much people who are steadily coming to the network meetings.
Good.
We do have to do more, I agree with you, and we still have a year and a half, so I'm hoping that our next phase will be even more engagement.
And these will be broad, but my last 2 questions, thanks for asking that. And I just want to give a shout out real quick to our policy analyst who's been with us here in the county board for a couple months now. She's kind of helping us look through all this. So shout out to Ariel. As we think about staffing at APS and the compensation for your employees, are you feeling that it is competitive enough to recruit and retain the right number of folks here within DHS? How are you feeling about that?
Yeah, I feel like we have the right salary and benefits package. It's a tough job, as is Child Protective Services. It's gut-wrenching, and sometimes people do get burned out and there is turnover.
Okay.
I would say that we do have some staff that we would consider them in the client pool of low income if they were a client.
Okay.
Because the starting salaries, and I'm not saying this is, you know, we have so many different types of classifications.
Right.
It's hard to sort of say. But we do have some who basically have the profile of a low income resident who are our
Yeah.
staff.
Last question. On your PMP, Performance Management Plan, I know, kudos to what you're doing right here. When do you think that the timeline will be to get to full coverage? You're at around 88% right
the
now. of all your-
PMPs?
Yeah, PMPs. Just,
We
You're
should
like,
be-
next
we
year?
should- We should be able to do that whenever we want to do it. The issue is that some of these are small and don't have really so much data that would warrant putting together a full plan.
Okay.
But I will review that with Michael Dharma and get back to you
All right.
about the,
I wanted to just add that we just started working on a PMP for broad-based initiatives
Right.
as opposed to programs.
we have
So-
one coming up for the Food Security Coalition.
And so
About to
we're going
publish.
to start with that one and then work on Marcus Alert. But those broad-based initiative kinds of performance management plans are kind of a little bit in line with what you're asking for, Susan, and they are very challenging, very
Well, yeah,
challenging.
I would love to talk more about long-term care and seniors and aging, but let's move on. Let's finish out the second half of your slide deck.
Yes.
Colleagues, if that's okay, we'll go ahead and get started.
We have time?
Yes, we do.
Okay. I keep worrying that we're going to run out of time here and in the middle of the sentence or something, but, okay, because we have another crop of interesting topics, and we have here Glenda Pittman, our newest Deputy Director for Operations. She is not new to the county. If anyone doesn't know Glenda Pittman, they should meet her. She's been here 42 years. 42 years.
Are you?
Wow. Okay, so we're going to talk about, first of all, food security. Slides coming up. Okay. These are sort of a variety of topics, but that are of interest, but are not, some of them are one-offs that you need to know about, but some are systemic issues. Food security. Well, that's was initiated under Matt DeFerranti, under one of his prior chairships, where we established a food security coalition with a food security coordinator, funded by the manager and the board. And we have a very successful coalition that includes different kinds of providers and community activists. And we have been awarding for the last 3 years a series of what we call mini grants, $150,000 worth. Last year, we awarded to 13 organizations, and in 25, it impacted 4,000 and some odd households. It's not funded in the FY27 budget, just so you know. There is pressure in food security. There's going to be more. Wait till I get to the SNAP slide. AFAC visits have gone up 7%. Other pantries also reporting increasing clients. The county gave $350,000 to AFAC during the 2025 federal shutdown, which was a great thing because of the potential of the loss of SNAP benefits. And we also, the community rallied, and Arlington Public Schools provided meals during the snowstorm. But this is going to be, as you know, cost of food, has doubled, I think, since 2000. CPI is up 3.1%, so this is going to be an increasing pressure and something for you to consider to what extent you want to fund that. That's another one of those unmet needs that could be voluminous. Next slide. Humanitarian assistance. $250,000 was provided in 2025 to the Arlington Community Foundation to respond to some of the humanitarian needs of very low-income families in Arlington that was contracted through two nonprofits, Just Neighbors and Legal Aid Justice Center. This grant is expiring also on June 30th and is not funded in the FY27 budget. Deliverables have been consultations with individuals who are going through issues related to their immigration status. We've been working with families to get them prepared should children be separated from parents, and a lot of Know Your Rights sessions, although what we know are the rights then are not the rights now, but those were provided. Next slide. HIV, and here's Dr. Deidre Parrish has brought this to us. Not the illness, the solution. that didn't come out right. I'm sorry, Dr.
Thank you for clarifying.
Ay. You know, when I get into this, I get a little slap happy after a while. But HIV has not gone away. And we have a very sexually active community. And you know what our profile looks like. It's not a pyramid, as Dr. Varghese used to say. It's a diamond. The big part in the middle is the 25 to 35-year-olds. And so we have still a prevalence of HIV and AIDS. I think the prevalence rate is 7.3 per 100,000 in Arlington. And so we have never offered PrEP before, and it's highly effective, 92 to 99% effectiveness when taken daily. The costs are low, and we can purchase the medication from the Virginia Department of Health. We don't need extra staffing because we can put this into the flow of our existing combo clinics where people come for STI testing to begin with or family planning. And so we'd like to give this a go. Dr. Parrish has brought in all the experts to provide the training and looking at the protocols, and we're anticipating a soft launch in March to expand our program. Next slide. Okay. The next two slides are about SNAP and Medicaid. Okay. I just want, these are highly complex, and we could have a different session for this, but I want you to know that the HR 1 bill is going to impact us both in SNAP and Medicaid. Brooke is not here, Brooke Hammond-Perez, to tell you all those things, but here are the big highlights. Number one, federal support for SNAP administrative costs is going to drop from 50% that they used to provide to 25% as of October 1st, to the tune of a revenue loss, because that money comes through what? Virginia Department of Social Services. Yeah, VDSS. And the revenue loss in 27 will be 1.9 million, but the annualized loss is 2.4 million. That's separate from whatever happens with the error rates, because there's the threat that if each state does not bring its error rates down to below 6% for SNAP calculations, we'll also be penalized. Arlington has brought its rates down to practically zero, but the state is still somewhere, I think, around 11%. So that could be a big penalty that will cost us additional money. And for the eligibility, so, you know, this is where the clients get penalized, self-attestations, that means clients, their own attestation to their income or expenses is no longer accepted. They have to provide documentation. The work requirement has been expanded, so now people up until age 64, used to be 55, have to be working. The dependent exception has been lowered, so it's now to 14 years of age. And certain non-citizen groups are going to become ineligible. Asylees, refugees, human trafficking survivors, Afghan and Ukrainian nationals paroled between 2021 and 2024. There's a risk of up to 3,593 households to lose benefits. So we have to increase our workload. Our workload will increase to verify the employment statuses and the expenditures. That's going to put a pressure on staff. And there is the threat of the loss of SNAP, which will mean more food insecurity and more demand on the food pantries. This is this year. Then we have Medicaid. Next slide. Well, Medicaid, as you remember, bless you, in 2018, the Governor Northam approved the expansion of Medicaid to people under age 65 with the income matching the the requirements, we had about 10,000 Arlingtonians, additional new people signed up for Medicaid and got coverage. Then, of course, came COVID. No, everyone forgot about reviewing everything, so we had to go back and review every single Medicaid eligibility case. Now, the same kinds of client impacts will be happening, the documentation requirements and the work requirements. 80 monthly hours will be required in employment, community service, or education to retain Medicaid coverage. So there is, again, the threat of up to, 8,400 and some odd Arlingtonians may lose medical coverage. This is a really significant concern. We've been talking to the free clinic and neighborhood health, who also rely on not the free clinic, but neighborhood health relies on Medicaid. They may see a big revenue loss. Virginia Hospital Center is going to experience increased pressure because they're going to have to pick up, I guess, the slack. So, and there's also workload for confirming the work requirements every 6 months. Children's Services Act. I brought the specialist here, Glenda Pittman, to describe to you what this is and why it's important.
As the slide indicates, we have had a significant increase in the Children's Services Act expenditures. Just to give you a little background, that funding comes from the Virginia Office of Children's Services. Within that funding, there is a 55% state match and a 45% county match. For FY27, we're projecting to be over budget by about $480,000. That is not included in the FY27 budget. And as you can tell from the slide, we are seeing significant increases in the number of clients served, going from 174 in FY24 to year-to-date 187. The expenditures are also increasing in FY26, which right now we're looking at probably about a $700,000 deficit in FY26 that we did not anticipate until around mid-year. And one of the major instances where we're seeing the greatest increase is in our congregate care placements or our residential placements, where our residential placements have gone up from 34 to 56 year-to-date. Some of the biggest drivers that is causing this increase is, one, we've had significant increases in our vendor rates. Vendor rates have increased from 20 to 50%, depending on the type of service, especially around residential placements. We're seeing many more kids that are coming into placements due to very unique critical needs that we've not seen in the past. The children or the youth are older than they have been in the past. They're from ages 13 to 17. And the other major increase is what we call court-ordered placements. And what that means is the kids are coming through JDR or court services, and the judges are ordering them to come into placement, and usually it is into residential services. And as we know, residential services are very, very costly, and so those are some of the major reasons in terms of why the services are increasing. Now, we'll say that when it comes to JDR, yes, the judges are making those determinations, and I, think that some of it is because of, legal determinations. They're getting recommendations from the guardian ad litems. They're getting recommendations from court services, and then they do rely on DHS from time to time. So we are looking at probably significant increases over the next few years. We have to figure out what we can do overall to try to mitigate those circumstances, serve those children and their families the best that we can, hopefully bringing them back into the community and using more of our community-based services versus using residential services.
Okay. Next slide. Thank you, Glenda. Summary of proposed changes. Corey? So we're at the time of summarizing some of our proposed additions and cuts. And you can see here, the proposed budget is $212,857,078, increase of 3.5% from FY '26. Revenue increase is slightly over 1.8 million. That's a 3.3% increase. FTE count, 817.22. There were some questions about how we got to our number of FTE increases because our reductions are 4.5, but our increases have to do with positions that came on during the year, including position from the opioid, funded through the Opioid Abatement Authority, a grant-funded epidemiologist, another kinship specialist, which was funded through a kinship grant. So it's sort of a net negative 2.5, even though in the reduction in force, it involves 4.5 people. Right. Okay, Corey.
Thank you, Anita. So I'm going to be going over the proposed changes that were added into the proposed budget. So we're starting off with the $770,000 in targeted prevention for Arlington's hardest to serve. This will be addressed in next week's housing session, so I'll move on. Next, we have a 3% increase for those contracts that have CPI clauses. That's 35 of our contracts have that language, and that's $527,000. Next, we have the conversion of 2 overstrength positions in the Public Assistance Bureau that were added to help the team handle the 75% increase in applications from FY '20 to FY '24. 2 of those are happening this year in '27, and then there will be 3 remaining for the Bureau. These positions are partially reimbursed by Virginia Department of Social Services at 58.75%, which makes the net cost to the county $295,000. We have the Active Batch software. So Active Batch is a workload automation and job scheduling software solution that DHS uses to automate many of our jobs. These include the AP interfaces for housing grants, permanent supportive housing, and housing choice voucher, as well as populate our data warehouse with various data sets. The current contract expires at the end of 2026, and we're partnering with purchasing to identify a new vendor for that solution. And once we do that, we're anticipating $225,000 will be needed in contractor support to help rewrite many of those 180 jobs. Next, we have the child care licensing system. This system went live in November of 2025. Because it's only active for a partial year in '26, we have a prorated budget of $358,000, and we need to add $171,900 in FY '27 to give us the full budget for $530,000 to fully fund that contract. Next, we have the 1.0 public health nurse that was added for the Arlington Career Center, which will be opening as the Grace Hopper Center next year or later this year. And adding this FTE will help the School Health Bureau maintain the ratio of 1 nurse to every high school. Next up, we have the catering contract for the Residential Program Center. Right now, the catering cost is not a part of that contract, and DHS has been funding that separately. And the budget for that is approximately $144,000, but we've been exceeding that budget quite a bit, so we're asking for an additional $125,000 to fully fund that. Next, we have the Yardi waitlist. So DHS does own the functionality for this, and our team is currently defining and weighing the requirements of that. And once we actually define what's needed in the waitlist configuration, we're projecting about $100,000 in contractor support to help configure, test, and train staff on that functionality. Then we have the annual Arlington Food Assistance Center contract. We're requesting $97,408 next year. That will make a FY '27 contract amount of $1.2 million. Lastly, on the expenditure side, we have a utility adjustment of $69,000, and that's the net of an electricity increase to $102,000, followed by a decrease to our vehicle fuel budget from $33,000 down to $6,500.
Next slide.
Lastly, we have 2 revenue increases. So the first of which is for the Clarendon House Psychosocial Rehab Program. We are adding $53,000 to that budget based on a redesign of Virginia Medicaid and how we bill that service, and the change from unit rates to daily rates based on our current clients' acuity will net us about $53,000 in additional Medicaid revenue. And lastly, we have the increases to the food establishment and water facility fees. We're going to be changing 5 of those fees. So for food establishments, we're going to be increasing the late renewal fee from $25 to $50. And we're going to be establishing a new fee for pre-opening re-inspections for those facilities who don't properly prepare for the initial inspection, and that will be a $100 fee. And on water facilities, for the year-round water facilities, we're going to be increasing the $400 license fee to $500, and the every additional pool there will go from $100 to $200. And our seasonal facilities will increase from $200 to $300, and the same additional pool fee increase of $100 to $200 will apply there as well. And lastly, we have a water facility plan review fee that will increase from $160 to $250.
Thank you, Mr. Travis. Okay, here's where we're talking about Culpeper, Matt. So Culpeper Garden Assisted Living is closing at the end of June. That is the only affordable assisted living, aside from Mary Marshall, which you know has a requirement of having people have behavioral health diagnoses. And you remembered correctly that last year, in addition to the regular $879,000 and change that we were providing, we offered them an additional $350,000, I think it was, because we were hopeful that that would help with the gap that they were projecting. And we had been in discussion about that for some time. But in spite of that funding, Culpeper Garden decided to close its assisted living, and their board voted in favor of that. We have this money set aside, $879,000, to support the 31 clients who were in assisted living, because they were very low income and we were paying for housing and care costs. During the year, as the residents were alerted that they would be losing their placements, family members and caregivers have been transferring them to either alternative settings, if available, moving them out, moving them back home, and some are planned to move into independent living, units without care. We have identified through monthly meetings, and the team is here, Rachel Coates is the lead of that team, that there are people who will be moved into independent living whose care they may not have ability to pay for by themselves, or they are at risk, and we do not believe that they may be able to sustain themselves completely independently. So what the Culpeper Garden has, and we have decided, is that we can support some of those folks through nursing case management and other wraparound services. We hope to do that by maintaining some of this money that was allotted for Culpeper Garden. Right now, we are maintaining $450,000 in the department's budget and returning $429,000 to the general fund. But it's really a matter of assessing, again, individual clients and what kinds of support they need, whether it's for managing their medication or for bathing or for any other kind of service. That's the situation there. Next slide. We had a change in public health leadership, as you remember. We created a new public health, simply public health director that is Dr. Deidre Parrish. And then we created a division director who's managing operations, and that's Robert Sharp. He was promoted from being an assistant division director, and so we are eliminating his old position. That's for $263,523. Next are the clinic aides that we discussed at the CIC, the behavioral health clinics aides, and What else? Next. A .5 communication specialist in the director's office is being cut. Next. A .75 facilities maintenance worker, the person who maintains our vehicles and paints when we need things to be, fixed on a quick basis. That's being eliminated. And some money is being taken from the developmental, from transportation for developmental services. Now, this is not to panic over because we still have 197,000 and change in the budget. LaVoice Reed and her staff, I don't know if LaVoice is still here, diligently over multiple years, carefully moved each and every client that had Medicaid, a Medicaid waiver or could pay for and didn't need our local monies anymore to an alternative form of transportation, usually Motive Care or Metro Access or Star. So we reduced a lot of money from the original transportation budget, and we took some last year. I think we might have taken the year before, I can't remember. There are very few people left who are who are still on the local transportation, so there's really no one who will be impacted by this reduction. Okay, I think that's it.
Well, thank you very much, and it looks like we got through the slides, and we have plenty of time, I think, for some
We do.
Q&A. I'm waiting to see lights from my colleagues. This is our last round of questions before we, end at 4:10 or a little bit thereafter. I see the chair has his light on. Chair.
Thank you, Mr. Spain. I hope I can just run through a couple of things that could be followed up on later. Ms. Friedman, you mentioned some are in a category where some DHS employees are in a category where they would qualify for.
Yes. Well,
Is it possible to get offline and separately as a question that either our CBO team or someone might mention a sense of what our lowest paid DHS staff are getting paid?
yeah, I'm not trying to give a heart attack to the county manager.
Sure.
But, I'm sure this is not unique to the Department of Human Services. If you look at the pay scale of the whole county's workforce, there are people that earn, I would say starting salaries of 50-something thousand or so.
Sure.
Which in most localities would probably be a
Yep.
good salary. In Arlington, not so much. And so people are living paycheck to paycheck. It's very interesting with the new outside employment form that was required, because I'm getting all of these approval requests. People do everything from,
Yep.
manning the front desk at a health spa versus, it's, people are struggling. So no matter what your income is, and unfortunately, as a staff,
No,
we
it's-
can't really
Sure,
help them.
and this is a question I had a little bit last year.
Yeah.
I'd love to start an email string or through the budget portal, just ask a question of a little bit of a picture of those earning at our lowest spaces, and I'm mindful that it's certainly 50 and probably 60 of the 99 counties in Virginia would be plenty. So that's, and I'm also mindful that we have collective bargaining, and that's another piece of it. So I'd just like to ask that question so that that I could take the burden and we could follow up on it. On hunger, I'm interested in, and really I think Stephanie Hopkins has done an outstanding job. And so she deserves the credit for pushing us forward. I guess I would be interested in if you could provide a little bit of context to the mini grants, other than the board is going to fund it. It has not been meant to be an entitlement, and there's been variability in the first 3 years. And so a little bit of thoughts on that, and I might have a question as to investment in the SNAP person as well.
Yeah. Well, I don't have the new plan in front of me.
It's okay.
But the mini grants have really been well-received. And, you know, we've always been, AFAC has been our steady partner for years, and it is a sole source contract because it is the only entity in Arlington that can sort of provide with the infrastructure and the outreach, the amount of food that it, you know, basically almost 5,000 visits a week. So the mini grants have gone to things like church groups that have pantries, food pantries. They need a new refrigerator to store food, or there are places where food hasn't been delivered before, so they're expanding their outreach. They're sort of niche activities that go deeper into the neighborhoods, I think. That's the way I could describe it.
Great. Well, I'm interested in understanding the 3 years, and
Yes.
I am not, as much as I do care about building our infrastructure, and I think
Yeah.
this year's hunger is as much of a challenge as any year. I want to understand it a little bit because I broadly support it on a nearly regular basis.
Right.
But I could see an argument that, you know, doing it every year might turn it into an entitlement,
I see.
and much as I believe that we should vastly increase our entitlements on the SNAP side, I'm still working on the other side.
Well, I think that plan is being finalized very soon, and I will get that to you, and
Sounds
we can
great.
set
Sounds great.
something up.
And I'm sure others will have questions. I would say that maybe I can just ask in hopes that Ariel might help, is I don't understand yet the Medicaid proposals from the Richmond, and so if there's some link that has a decent summary on Friday or Monday of the budget, what we're doing on that, because I can't put this budget together with what I think may be happening in the state on healthcare, that would be my request, not for you to have to answer now or anyone to
No
have to
one
answer.
knows what the state is doing on healthcare.
Yeah, but once the budget, I think that is important for us. Once the budget is, the conferees have done the budget. And I guess lastly, on homelessness, I just want to, and now yield for the rest, is I do think that a lot of the homelessness work that I'm interested in is infrastructure related. And so I'd really love to have a 2x2 conversation before the CIP on that.
Yeah, well, on the 18th, when we do our housing presentation, we will go in-depth in.
Great.
into
Sorry to take so much time.
Thank you, Mr.
Thank you.
Thank you, Mr. Chair. Madam Vice Chair.
Sure. Let's see, trying to organize many different thoughts here. To kind of pick up, I guess, on the federal impacts question and what is the state doing on SNAP, has VDSS said anything about how the cost share will be handled if/when the error rate costs kick in? Because, you know, if we have a very good error rate and others in the Commonwealth do not, one would love for that to be factored into who pays, but it's hard for me to imagine that will be how that is played out. But I also don't know if they've even commented on the plan.
Glenda attends the Virginia League of Social Services Executives, so she knows.
Well, to answer your question, as of right now, it's an all for one. No matter what locality, if Arlington is doing much better, there's going to be no difference in how the reductions are going to be distributed. One thing that I have heard is that the VDSS is looking at trying to make up some of the reduction within their state budget.
Okay.
So hopefully that will come to fruition.
Great. So some meaning a number between 0 and 100.
And 2.4 million.
Yeah.
Right.
Yeah. Helpful, but obviously would be great to have a guarantee. And
I don't think that's
we're not gonna. Yeah. No, absolutely. I think just conscious that continues to be a budget pressure and concern for us, as we are obviously not going to allow our SNAP benefit to be reduced because of the changes to the federal budget. So I appreciate that. And I think relatedly as well, I know during the federal appropriations process, Meals on Wheels was really advocating because they were another group that was potentially going to be impacted. Do we know, do we provide them direct funding at all? And do we know if they are adequately supported, especially given the increasing pressure on that program and on our seniors?
Do you know the answer? Oh, do you know the answer? Or does Maimuna here? No.
Come on up.
Come on up, Maimuna or Rachel. One of you folks knows the answer, I'm sure. This is Maimuna Ba. She's the Director of Aging Disability Services.
That's right.
So our Meals on Wheels volunteer program is a very close partner. We pay for the cost of the meal, and we actually have a federal funding under Older Americans Act. They also do a lot of fundraising efforts. They're part of Meals on Wheels of America. So that's something that we encourage, as well as applying for NOFA funds.
Right, but we're not paying to the federal entity of Meals on Wheels, no.
No,
Okay.
right, we pay for the cost of the meal.
Right, and the rest is the volunteers are running the operation here in
They're
Arlington.
part of a 501.
Got it. Okay, thank you. That's really helpful. And while you're here, I just want to commend you and Rachel and ADS for how you've worked. I think Culpeper Gardens was a hugely stressful transition for so many families, but also for our staff who care so deeply about our residents. And I know that, this was not a decision within our control, but I just, you all really stepped up to give that individual case management service to every single resident in the assisted living facility side of it. And it really means so much. I think that is one of the things that is above and beyond that our community expects. It is, it's very interesting how many things that are above and beyond that have become the basic expectation here in Arlington. But I really, really appreciate what you all did and are continuing and will continue to do. So while you're here, wanted to say thank you.
Thank you.
And then my last question, really around the Child Services Act and kind of combining a couple, both DHS parts of the budget and then also JDR parts of the budget. It does feel like foster care services are increasing. Our number of adults in court-involved, adults in domestic violence cases are increasing. We also know from national evidence-based practices that when there is economic insecurity and disruption, all of those types of cases increase. We are, as you said, using more than our CSA allocation to try and fund these services. Is this an emerging area of concern for us that this trend is going to continue long term? And I guess how can we support and make sure that we are not reacting, but really being proactive to try and serve both the children and then also the adults and parents that are involved in these situations?
We can have Tabitha come up if she wants to.
Ms. Tabitha.
Absolutely.
I guess just to start, I think over the years, CSA started like back in 1998, so I think we've seen the ebb and flows over the years. But I think one of the things that we're seeing now is the critical needs, in terms of the families that are, the needs that they're presenting. And for those needs, unfortunately, some of those needs cannot be served like within the community, especially for young adults with substance use issues, or they have, I guess what you call it, co-occurring issues from mental health and substance use. So even trying to find services to support them is not easy, especially in Virginia, in Arlington County. I mean, we are even looking outside of Virginia. I mean, we had one youth that was in Connecticut. Wow. And so for right now, I don't think that we're going to see a decline in the trend of children and families that we're seeing, and especially those that are coming from the school system and then through the court system. One of the goals that we have is that they will not come into foster care. The goal is that we're able to serve them in their in the schools or in court services, them not coming to foster care. Because one of the things the CSA will allow is for the funding to be used by those two entities, because the money for CSA is a consortium of funding for DHS, for JDR, and for APS.
Okay.
And so the money is in DHS, but we spend, or we share the
Yeah.
wealth, so to speak, with
We pay for JDR
for JDR.
services.
The JDR expenditures are in the DHS
Okay.
budget. The APS funding was actually transferred to APS many years ago.
Yeah.
Okay.
You want to say anything about what you're seeing in foster care and community-based versus residential? You're on.
Yeah.
Okay. Very good synopsis. Thank you. But I will say, with all of the efforts that we have, we are seeing an uptick in children coming into foster care. So that is also a driver of the expenditures for congregate care facilities. However, I will say, we are working in partnership with courts, the judges, schools, so that we can staff very complex cases, so that we can identify and then put in community-based services or least restrictive care to the best extent possible. The fact of the matter is that kids and youth are experiencing more complex trauma than we've seen in decades. And we are feverishly working to identify and co-create services to address the gaps. And thank you for investing in us, because school-based mental health, for example, and our outpatient services, we are building a continuum of care that is strong. And so we are doing the best that we can to mitigate risk and harm. We're going to get out there in the community even wider to educate, for example, our Arlington public school partners around mandated reporter for child abuse, so that we can then, be that safety net provider as well there.
And we're leading the state in kinship care.
Absolutely. For years, we have led the state of Virginia in the amount of youth who are placed with relatives if they are in fact removed from their birth parents. And so even though we have more kids in foster care, we also have more kids who are have reduced trauma because they are able to stay with their relatives and remain in the community and keep stability with their schools and have community connections. So,
Yeah, I mean, quite frankly, the out-of-state placements are very costly.
Yeah.
And they don't serve the child well, because they're distanced from any possibility of reunification with biological family. And the cost, and especially if it's court-ordered, we have to do it. We had one child last year was like $222,000 to keep this one kid in a congregate placement. There was no alternative. So it's expensive.
Yeah. Thank you. Madam Vice Chair?
Thank you.
I'll stop there for now. I think a lot of my other questions go back to the JDR side, but thank you. I really
Okay.
appreciate it.
We're going to go to Board Member Karen Tonis, and then followed by Board Member Cunningham.
Thank you, Mr. Spain. Let me preface this. I fully agree with our chair, Mr. DeFerranti, that a lot on the Medicaid issue, a lot depends on the budget of the Commonwealth. However, we see a trend here. The trend is that more people are falling off, that we are running behind to patch it up, but the problem is the long-term consequences of that. So there is a public health deterioration that I see there. And I wonder whether we should begin to think about restructuring services on this. Granted that I don't want to precipitate until I know where the Commonwealth will come to stop, but even the Commonwealth's budget is not not unchallenged, and it will be challenged also on the federal side. I mean, this is not going to be one and done, and we are good for the foreseeable future. So typically what happens in these situations is that certain types of health challenges are more prevalent. Certain parts of the population are going to be more affected than others. Certain age brackets will be more affected than others. So that is for me a concern, and I'm trying to figure out what is the proper positioning here to begin to work with that. You said that, well, we are working with the free clinic, and we know that neighborhood health depends actually on Medicaid, and I'm hoping that we are going to save the neighborhood health services. But the free clinic are already oversubscribed, like woefully oversubscribed. The free clinic, which is a very strong fundraiser, had red numbers this year. So I don't feel comfortable there.
Yeah. No, I agree with you. I mean, it is a great concern because the free clinic is at 1,600 households, I think, the last time I spoke with Leslie. They are, they do have gaps in their funding. Neighborhood health is also not clear on. We just spoke with Dr. Khan a couple of days ago. Arlington, and I'm not trying to be a critic, but we do not invest in primary care the way that Fairfax or Alexandria have. You remember that neighborhood health actually started in Alexandria. It was called ANSI. They had decided long ago that they were going to provide primary care to the uninsured and low income. Arlington did not decide that, although I did see a booklet from 1969 where we did, but not for a long time. So we are not equipped to sort of replace any kind of care that falls off. The hospital is probably the best one that would be equipped, and we have to have those kinds of conversations, I think, with the hospital, too.
Which is the most outrageous, expensive way to deal with that. I want to follow up with that. Colleagues, I'm very interested in this because I've seen that problem already, having a financial footprint. Talking only the human footprint is a completely different order. The second thing is, is also, healthcare, but also living support related. So Culpeper, so now we don't have even the small Culpeper program for assisted living.
We will not as of June 30th.
Right.
Correct.
So what is going to happen for those who will need assisted living services, and there is no way to afford them because they are extremely expensive?
Well, it's a combination of moving people out to other jurisdictions, and their families have to be responsible, and attempting to move those folks who are some can handle, activities of daily living to independent units, and then having our nursing case management contractor go in on the basis needed to do some of those, to help with some of those tasks, which are typically like medication management, bathing, not feeding really, right? No. Yeah. So that's what we're going to try to do. It's really something we haven't done before in that sense, but we do provide a lot of nursing case management for other older adults who live independently in various places.
So financially, this accounts for, our investment in this trial to adapt is these $429,000 that we are not going to transfer to Culpeper anymore.
Well, we're not transferring anything to Culpeper unless you tell me to, but, that there's some reason for it. We're going to keep the funding in the department in order to fund our contract that has a nursing case management, sort of they go out, they're nursing aides.
Right.
We deploy them, Rachel's staff deploys them to wherever there's seniors who are living in the community independently who need some kind of support with those ADLs.
Because Culpeper core business was also, they justified their decision by saying that their revenue side will look better after that. And that means for me, will they need less support from us?
Rachel, you have any insight into this? Rachel knows
I
the
want to
ins
be
and
clear,
outs.
we don't provide, other than the 829, we don't provide any other assistance to them.
Because it would be like
That's
providing
gone. Yeah.
money to any affordable housing.
Right.
They'll become basically an affordable housing for
You
seniors,
can get them.
right?
Rachel, just pull
Go ahead,
the
Rachel.
microphone. No, you have the, it's off, you have to pull it to you, hit the button.
This is Rachel Coates, Bureau Director for Aging and Disabilities.
Yes, yes.
You're on.
Yes.
gonna be
No, with the Culpeper Garden Board decision to close the assisted living side, the residents will be able to stay in their housing, but the support services they received will no longer be available. So like many of the older adults who reside in Arlington, they'll be able to access home and community-based services, but for those who are particularly lower income, oftentimes that's through aging and disability services. So we do have case management services through our nursing case management program, social workers through our adult services program, and then a community living program, which does receive a lot of local support. And those are aides that go out through the community to help with those personal care needs. It may be meal preparation, as Anita said, but it really is an investment in keeping people at home in the community in that least restrictive setting, which is more cost efficient. And with the anticipated cuts to Medicaid, that the investment locally is helping people age in the community of their choice, which is Arlington because of the amenities that we have and having that wraparound services. But it is going to be a loss. It's something we're closely monitoring. Anita and Deborah have been with us every step of the way in meeting with Culpeper Garden, but we do want to ensure the smoothest transition for the residents and their caregivers, especially those who don't have a lot of those supports.
Right, thank you. So just in the philosophy of continuum that has no holes, I see a hole there. And this is a hole that I have a lot of respect for because I believe that the demand for this will be, I mean, we've started this conversation with demographics here, that the demand will be extraordinarily dynamic for that. And so we're already trying to stabilize at a very low level of response here.
Thank you.
And
Thank
that
you,
I
Mr.
see as a
Caratos.
risk.
Ms. Cunningham.
Last year in this work session and in the markups that followed, there were two things that I had hoped we could do and we didn't. So one of them I see is not your fault, it's our decisions. One was sort of investing in reducing the administrative burden for your team and also for customers across and landlords with the Yardi investment. So I'm really excited to see that that's been moving forward and that there are other investments here that are clearly about reducing friction in the system. And I think that principle and those investments are probably the only thing that are going to save us in this, next couple of years. Is all the costs are shifting our way, the burdens are shifting our way, the burdens are being jacked up on purpose, and that's likely to continue. And so I would just invite us to think creatively about those investments, including whether some of them might be capitalized. Were you constrained by trying to fit it in the operating budget? If they're multi-year, 10-year systems, could we capitalize them? I think there are times we wished we had capitalized previous investments, but just really drilling into how can we be as streamlined as possible because help is not coming from the feds. And back to the SNAP question, at what point does the decline in funding and all of the administrative crap that's a technical term, sorry. All of that, really just outweigh, at what point do we just say, forget it, we're gonna do it locally, we're gonna do it really well, maybe we're gonna sell services back to the state to help them do it really well. I think some of those bigger shifts we need to zoom out enough to think about. And I know in October last year, you all zoomed out and dropped everything else to think about short term. And I thank God it didn't come to pass, but thank you for the incredible work. But I really would push us, especially for next year's budget, if not for the CIP, to think about how can we do more faster and get it to be as frictionless as possible. So that's one area. And then the second one I had, my other wish list last year was taking some friction out of the philanthropic partner side of things, which you all have been working quite a deal on to improve the contracts and to make sure that those were sustainable going forward. So thank you for that. But I wonder, given all the funding uncertainty and the likelihood that we are going to have to fill new gaps and do that with our nonprofit partners, are there ways we can support each other? You know, we do still have a 3-tiered community, and the top tier has a great deal of wealth and resources. The middle tier is very stressed right now, but may on the other side have some resources again. How can we, you know, I think last year the idea was, you know, can we do a one-time, you know, effort to support one of the nonprofits to do a full fundraising campaign or to do some estate planning or something to that effect. But I'd really like us to think about that this year, because I think these next couple of years are going to be very, very hard on our side. We will not be able to do it all with tax support. And we have a community that cares deeply and that has resources that may be able to be shared.
And I do think that the nonprofits who are now gathered under the name of the Arlington Nonprofit Collective, ANC, which I associate with South Africa, but that's the acronym they've chosen, they are really, under Devanshi Patel's leadership, they are really considering how they can pool together different administrative needs that they have, you know. They all need payroll, they all need development, they all need, but, you know, that's something that takes time to negotiate, and you have to build the trust to be able to have that. I know in the manager's comments, there's, you know, we're on the lookout to see where there are drops or gaps in funding. That will be a topic of discussion on the 18th because of the HUD funding for the continuum of care. That may be impacted. And, you know, and then there are other, you know, other kinds of programs I think that nonprofits want to do. Building additional housing for homeless, and so there's a lot of desire for support from the county, and we do the best we can within what we have. But we need to think of it even more, I think.
Great, thank you.
Okay. Well, I know we're a little bit over time, and I'm going to have one question. You mind if the public health director comes up, Ms. Freeman?
Absolutely.
Thank you.
I told her.
And again, welcome to our public health director. I am listening to everything that's going on, and you're the expert, epidemiology, all this stuff. I just want you to kind of walk us through. There's a lot going on, uncertainty at the federal level, if you're talking about what's happening at NIH, what's happening with at DHS, Department of Health and Human Services. You know, folks aren't getting vaccinated. There's different regulations coming out. From a community, from a public health perspective, what should we be prepared for, thinking about in the next 2, 3, 4 years, given not just certain uncertainty in federal government, but like from a public health service perspective?
Yeah, thank you for that question, Mr. Spain, and thank you for having me, entire board. Yeah, so I think some good news that we have with our new Commonwealth administration in Virginia is that our new health commissioner and VDH, Virginia Department of Health as a whole, has aligned with evidence-based public health guidance. In particular, for instance, for childhood immunizations, VDH has aligned with the American Academy of Pediatrics, which, you know, maintains the childhood vaccination schedule that was uniform before there were changes at HHS. Also, Virginia has recently joined the Northeast Public Health Alliance, which is a collection of public health jurisdictions, big city and state jurisdictions that includes most of the jurisdictions in the Washington metro area, as well as the Northeast to basically protect and reinforce evidence-based in public health. So with that alliance, I think health is, I think that we are in a good position to support each other and to ensure that any potential, threats to threats to the science or threats to the things that we do can be mitigated.
Great. And we talked earlier, I think, before we started the hearing here today, and I know there's some movement, Anita, as far as the public health area, and I'm assuming that you have all the tools and everything you need to be successful. I know you've been here less than a year, but you're feeling comfortable from a public health perspective, right, in this new role?
Yes, I'm feeling very comfortable, and I appreciate all of the support from everybody, especially everybody in this room. And I know we'll be talking more. I'm still in kind of the assessment stages of kind of seeing where we are in terms of public health in Arlington and where we need to go, particularly focused on health equity. So you'll hear more, as we proceed with some of our different initiatives and assessments.
Okay, thank you. Lastly, Mr. Chair, and I know you probably, I don't know if you want to go to a second round or we just want to submit questions for the record. Ms. Freeman, you mentioned, shout out to our nonprofits that are doing a lot of work. And I've been to some of those meetings where that collaborative kind of came together. I would just state that, local government and DHS, in my opinion, plays a critical role in helping these nonprofits kind of engage in the areas that we think are most important. You kind of alluded to this a little bit, but what I've seen for many years of working in the nonprofit space is, people have to pay payrolls, people got to do all this, but we really need to identify what the issues are, back to something Ms. Cunningham is talking about, right? So we don't have a lot of duplication and redundancy of efforts. Okay, so thank you for your work on that. And Mr. Chair, I'm not sure if we want to do a second round or we just want to do questions for the record, but I don't see any more lights on, but I'll turn it back over to you as we finish up this segment.
Thank you. We're both in charge, we're all in charge, and there's no second round. Sorry about that. Sorry about that.
Questions, no
But
time.
send them in via email. And I think you had scheduled, there's some judges here, but you had scheduled maybe a brief break.
Yeah, we're going to take a break. So I just got it. So the time right now is 4:35, colleagues. Do we want to come back at 4:40? 4:40, we'll start back. Thank you.
Hope that's okay.
We're going to take a quick break. I know I saw you go back. I'm sitting at home this morning at the table. I'm like, what in the world? Yeah. It is what it is. All right.
Go ahead, Mr. Spain.
Thank you. So next we have scheduled for budget briefing is our General District Court. So who do we have? The Judge Rucker and Ryan?
Mr. Henshaw.
Thank you very much. Good afternoon. Thank you for being with us. Our plan is to probably go around 15, 20 minutes with your presentation, followed by another 15 minutes of questions from the team here. Is that okay? Yes, sir. Thank you very much. The floor is yours.
I was going to let Mr. Henshaw, our clerk of court, but first if I can introduce myself.
Sure.
Is my mic on?
I don't think so. There you go.
Red means on.
Mr. Chair, Madam Vice Chair, County Board members, our County Manager, Mr. Schwartz, thank you very much for having us. My name is Jason Rucker. I am one of 3 judges with the Arlington County General District Court. Currently, I'm Chief Judge. That's a distinction that we rotate every 2 years. My colleagues on the bench are Judge Carrie Steele and Judge Adam Krischer. Our court administrator is Tarsha Fisher. And to my left here is Brian Henshaw, our clerk of court.
Yes, and Your Honor, you just stole my thunder. You just took my opening
Oh,
paragraph
well,
away.
excuse me.
That's okay, that's all right.
Mr. Henshaw prepared the slides, most of the presentation. I was going to let him take the lead. Thank you.
Thank you.
Thank you, Your Honor. Mr. Chair, members of the board, county manager, members of the public, thank you for hearing the Arlington County General District Court clerk's office today. As Judge Rucker said, I'm Brian Henshaw, the clerk of court, and we'll just jump right on into, I believe we'll go to slide 3.
Okay.
So just a really quick department overview for you all. The General District Court provides over the following, basically criminal and traffic cases. We provide over misdemeanor charges, traffic infractions, and preliminary hearings to determine probable cause and felony cases. We preside over all criminal and traffic matters prior to cases being appealed or certified to the circuit court after a summons or a warrant is issued. We also preside over civil matters. The GDC is concurrent jurisdiction with circuit court, presides over civil claims, and for damages not greater than $50,000, with some special exceptions being that there are no damage limits where unlawful detainers. We have exclusive jurisdiction over small claims for damages not greater than $5,000 roughly, and litigants are not allowed to have legal representation. We also preside over involuntary mental commitment hearings for Arlington County through special justices appointed by the court, with hearings at the Virginia Hospital Center in Arlington. Clerk's office's role in this is we process and maintain all the records for criminal warrants, civil cases, and traffic summons, as well as civil commitments. This includes entry and record of the court proceedings and financial record. Next slide. So basically our budget highlights, we continue to build upon the success of our e-filing feature on the county's website. I can also tell you the state is actually actively looking into doing this across the state, so we may be transitioning to a state, which would be actually helpful and bring it right into our system as opposed to the way we currently do it. But it has been a huge success so far. We also continue to work with DTS in creating ways to better serve the residents and citizens and those interacting with the Arlington General District Court. And we continue to develop innovative ways to make the General District Court more accessible and collaborate with our neighboring courthouse agencies. Next slide, please. This is where I will turn it over to Judge Rucker as we focus on equity. And one of the biggest things I think is that we like to share with you all is kind of the success of our behavioral health docket. So I'll turn it over to you, Judge Rucker.
Sure. So I think, first of all, I want to thank you all for the funding that you provide to certain agencies that maybe not directly you're funding our court, but it does reach us. And one of the ways that that happens is the funding that you provide for DHS that allows us to staff that with the number of stakeholders that we have with our behavioral health docket. We have the Commonwealth Attorney's Office, we have the Public Defender's Office, we have probation, we have pretrial services. We have a number of case managers, we have clinicians, and it's just a great number of stakeholders that, and we could not have this BHD docket, behavioral health docket, without the funding and assistance from the board, so thank you for that. And just some highlights recently from the BHD. For those of you who don't know, our BHD is designed as basically a program to pull people out of the criminal docket So they're out of the criminal docket, those individuals that may have a serious mental health illness or dual diagnosis that's based on some medical diagnosis, some intensity, or duration of symptoms. They're diverted out of the criminal court and placed into our program. Just this fiscal year, in our fiscal year, July 1, 2025, which will go through June 30th, 2026, we've had 3 graduates of the program. We have another one coming up on March 25th to graduate from our program. Last fiscal year, we had 4 graduates. Since our inception, which started in 2019, the program was really spearheaded by Judge O'Brien, who's now retired. But since 2019, we have had 16 graduates from the program. And I've asked our BHD director, if you want to call it, Ms. Neiman, to look back at some of the data on this. And of those graduates, we have a very low rate of rearrest. For the last 2 years after graduation, so this is post-graduation, just looking at 2 years, 70% of our graduates have not rearrested, have not been rearrested for any criminal offenses. It's also a great deal of success that we have with our graduates remaining connected with Department of Human Services, remaining connected with case managers, case workers, as they continue to remain in the community. The BHD has been very successful. We also will, all our stakeholders, we get together every year. We talk about other ways that we can improve our program. We call it a retreat, but we meet right down at DHS. All our stakeholders get together to talk about our program and how we can continue to improve it. And every year we also have continuing legal education, and we have another legal education seminar that's scheduled for September this year that our stakeholders will be going to. So also, so that's the BHD, but you guys also, some of the funding that you also provide, not just through DHS, but through housing with our rental assistance programs. I mean, it's been a great help for us in our civil docket, in our unlawful detainer docket that we have, or that's just a statutory word for evictions that we have in our court. The rental assistance that you all provide has been just a great help to our community members, our citizens in Arlington County. You'll be surprised. I mean, we have a UD docket every single day, but the large docket takes place on Thursday. And on a regular basis, there's a member of the county that is there to offer assistance, answer questions to individuals that are facing eviction, that are there to help them answer any questions they have and get them enrolled into rental assistance and help them with that application process. We also have set up, as you can see, outreach to legal aid agencies to provide tenant guidance. We have offered Legal Services of Northern Virginia a room that they have dedicated to them outside of our UD docket courtroom that we'll have on the 3rd floor. So they use that space to store their materials on a UD docket day. You'll see them there. They'll pull out the table. They'll be manning that station with their information, also to answer legal questions that someone may have. Because, you know, our county employee that there, they can't give legal advice, but the Legal Services of Northern Virginia can be there to answer any legal questions that they may have. We also have updated some information and pamphlet information that we will attach to unlawful detainers that are going out for service to tenants to give them just a quick information about local resources, Legal Services of Northern Virginia, DHS, how to link up with rental assistance information, also Virginia Poverty Center that they can call, and we have that in a number of different translations. We are limited at this point about how much information we can give. We can't offer legal advice. Just this session, though, in our General Assembly, there is a bill that's been proposed, and I think it came out of committee, that would allow us to provide more just basic information and advice that would permit us to do that. So we're going to see if that passes and if that's something we can also give more information, some more information to these tenants when they're served. So that's what I have about some of that focus on equity, but thank you all very much for that.
Next slide. So just in summary, our budget summary really does not present many new changes from our proposal from years past. It's mainly to cover our everyday expenses and the salaries of our one full-time salary, and then other than that, supplement for staff. The slight increase to the proposed budget is only due to incremental increases of employee salaries over time. Next slide. with the significant budget changes that.
Brian, before you go on,
Yeah, sure.
can I interrupt?
Sure.
I just want to say about the supplement that you provide for our clerk's office. First of all, let me say our clerk's office is some of the hardest working, dedicated people that you will ever meet. And their salary is set by the state employees. And these are all young professionals, and you can imagine their salary is static compared to some other, state employee that's working in a different part of this state. Maybe, some rural county near Roanoke or something. They're the same salary scale, but without your supplement that you guys provide us, there's no way we could get the caliber of young professionals that we get coming in. It's always a challenge to, keep them there because they are young professionals and they're looking to advance. And many times they come into our clerk's office and they remain in the county, but move to just different departments, stepping up in their advancement of their profession. But it's vital that the supplement that you give us to our clerk's office that allows us to get those bright young professionals in there. So thank you for it. So I'm sorry to interrupt, Brian.
No,
Thank
that's
you.
right. So, we, like every other department, did look at impacts and ways that we could do our part. We don't anticipate any major impacts based on the reduction that we've looked at. I think it is important to note, I know there was some of the information that was been provided, basically talked about the fact that, the increasing health costs and retirement contributions. It's important to know that as state employees of the clerk's office and also the judges, the county does not provide any health insurance or retirement contributions to staff members of the General Justice Court as that's provided by the state. So basically the only thing that comes to us is the supplement, which as Judge Rucker acknowledged is we're very thankful, and it does keep our rates of vacancies down very much. The proposed budget reductions come from a line item, and we can explain a little bit more than this, but I'll just basically give you these funds are set aside for dependents request an appointed attorney, but has been charged with like a local Arlington code. So in other words, for whatever reason, sometimes these are upgraded to the state equivalent code. But sometimes on a rare occasion, much more rare now than usual, used to be a little bit more widely used, but this is basically, those cases are prosecuted under the local code. If they're asked for an appointed attorney, the county funds actually have to cover that. And so those requests just aren't coming in as much as they did, so we felt like this was an easy way for us to help with our reduction of the budget. Next slide. All right, so just in kind of wrapping up, as a reminder, the court and clerk's office cannot offer any guarantees. This is something we normally say with any anticipated revenues. Our primary focus is to provide access to justice to all residents and citizens interacting with the court system. That is our focus always. We continue to appreciate the support of the employee supplements. I think you summed that up very, very well.
Okay, I'm sorry.
I was getting to it. Yeah,
My bad. I'm sorry, Brian.
That's
Didn't mean
okay.
to
That's
take
all
that.
right. But we are extremely thankful for that continued support. I know a lot of my colleagues go and they are requesting this at their boards, and I think we've been very successful here. I can tell you it does help with our attraction. A lot of times, just like in the county's issue, sometimes it's not as easy to live where you work, and that's the goal of a lot of staff members. But this does certainly help to help our retention rate and also our attractiveness. Other than that, the clerk's office continues to be also supportive of the investment in the courthouse renovations, which even if that slows down, it has been noticed, and we're appreciative of that effort. That is pretty much all we have. We'll be happy to take any questions.
Okay.
If I
For
could
your
just-
honor.
Sorry,
Go
Mr.
ahead.
Payne. Go ahead.
No, you're going to.
I just wanted to follow up one thing. I did forget to mention DTS. We're getting some technology upgrades in the courtrooms. They're also wrapping around some other improvements in the courtroom, and I should acknowledge that they're doing a wonderful job. They're great to work with, and so thank you all for that also.
Yeah. Well, Your Honor, and Brian, thank you very much. I'm going to open it up to looking to my colleagues here. Mr. Chair.
Just a quick comment. Thank you for continuing the behavioral health docket. and leading on that after Judge O'Brien started it. Super important to me, and I think more broadly, Mr. Manager sort of shared, efforts to keep people out of our jail are super important, and I don't think we're yet to the point where we talked about where those are the strategic investments that I wonder about, because we will have asks, of course, from our sheriffs, but I just invite your continued brainstorming with us, probably not in this, unless you have burning things to say in this moment, Your Honor, but that'd be great, and at some point I'd love to meet the new judge, but that's just a separate piece. That's all I got. Thank you.
Yes, thank you.
Thank you, Mr. Chair. Madam Vice Chair?
Yeah, I appreciate that you all are the ones that handle a lot of our housing-related cases, and I know that those can be some of the most challenging. I think hopefully we'll get some good legislation out of the General Assembly this year. A lot of changes proposed to the Virginia Residential Landlord-Tenant Act, a lot of an extension proposed for evictions from the, was it 5 or 7 days now to hopefully 14.
5 days or 14 days. I saw that legislation too. I think it came out of committee, so yes.
Yeah, I think that one's headed to the governor as far as I know, but I'm wondering if you have any sense of how some of those changes might impact caseloads. I know that we've seen a steady increase in eviction cases in Arlington and across the Commonwealth, and whether you think that there's a chance that we could see less cases, or do you think they're just going to be kind of pushed back, or if you have any opinion at all about that?
I can't forecast, what is what would happen with this new legislation, or forecast what's going to happen in the future. I know that there has been a bit of an increase really after COVID started to clear up. We started to see more UD cases coming back into the court. I know that it's just further protections for tenants to give them more of an opportunity. That 14 days, for example, that new law came into place, maybe get them, and if we can give them more information when they're served with that about resources that are available, that it could help them get connected to rental assistance more quickly. And then that extra 14 days could give them more time to get that set up through the application process. And by the time their first return comes to court, they may already have an agreement in place with some funds already being distributed. But Madam Vice Chair, it's hard for me to forecast and predict that. But I know there's always this interest in protecting a tenant's rights, so I get it.
Yeah, absolutely. And I appreciate that you can't commit to anything. But I think it's a huge, housing is obviously a huge interest in protecting our tenants, is been very challenging under the existing laws that Virginia has. And so I appreciate the insight, and I'll pass along.
Okay. Board Member Cunningham?
Great. Thank you so much for being here and for all the work you do to keep our community safe and whole. I really appreciate the raising up the issue of the supplementals. And I think what we see across a lot of our partner programs that are thought of as state-funded but aren't really state-funded sufficiently is that it's a growing cost for our taxpayers over time. Obviously, it's important, but I'd like us to get an understanding, and DMF can help us with this, but understand like the total cost in local dollars that we are investing in the supplement. And then there's, facilities and DTS and other supports like that, just so we can acknowledge it and plan for it and explain it, frankly, to our community who are seeing cuts in other places, because we do need to continue to invest in these sort of preventative and important solutions. So we'll carry that offline. But I think related to that is kind of the same question I asked DHS team earlier, was how do we look at the whole continuum of care, from prevention to recidivism to reentry, and how can we articulate how much we're saving by doing that well or investing more? So can you help us, or tell that story across this year and going into next year's budget as well, of the investment here, $1 pays off 10x at the end by prevention? So just a wish list.
Well, investing early in treatment, whether it's mental health treatment or substance abuse treatment, investing early in the process in that, even before someone gets to court. I think the earlier you invest in that, there's going to be cost savings multiplied 2, 3, 4, 5 times down the road by the time if we wait until they're actually in court or farther down the line while they're in court. So I think an emphasis on early intervention. It's hard to catch everybody, obviously, and I know DHS is working to get those agencies in place and implement that to get the assistance there before they get to court. But after arrest, again, I think investment in bond diversion, get wraparound services around individuals early in the court case. Because just for example, if someone has mental health, is dealing with a serious mental health illness, and they're in jail, there's going to be a request for bond for them to be released. If we can get them into a bond diversion program and they start to realize, wow, this really is helping me, medication does help me, by the time that their case actually does then come to court, now they've already built up that trust in the services that are in place, then they're more likely and I think would be willing to get into our BHD program, because that also is voluntary. We can't force anybody to get into the BHD program, but all of this early intervention, I think can dovetail into, further treatment down the road, which is going to then stop rearrests and more costs that are always associated with all that revolving door. So early investment in treatment, substance abuse, mental health, I think is going to have an immense impact on cost savings down the road.
Great. And then I'll just lift up the work you're doing with DTS and your own team to invest in reducing friction in your own work and in the folks that you're interacting with. Are there more investments there that you feel like you wish you could do, but you've been constrained by, that might actually have a return on investment and cost savings if we were able to find funding for them?
With our courthouse improvements?
And your technology improvements and platforms.
DTS has been very responsive to us and has been bending over to help us. So right now, I think more things are going wireless. So we're getting rid of a lot of the cords and things like that. And just working on some, it may seem like simple things to talk about, but for us, the way the courthouse was built so many years ago, we just didn't have that capability. But they're very helpful, and right now, nothing comes to mind that we're missing. So
I won't keep asking, so thank you.
No, thank you. Thank you.
Just pass it on.
Mr. Karatornis.
Thank you. Judge, Mr. Clerk, thank you. It's always good to check in this time for the budget. There is always a question that I read through the budget narrative every year, and I really appreciate all the effort that you put in. It sounds like the workload for the court is actually increasing. So the criminal cases are stabilizing somewhere between 8,000 and 9,000 cases a year, but civil cases are continuously increasing. And, I'm not surprised that TTS has to jump in, because you have to manage that somehow. And, first line of defense here would be to try to improve processes. So can you elaborate a little bit on that? Where are we going? Why is that happening? Why is there a specific reason, or it's just, we're a litigious society, or what happens with that?
There's a couple different things. I think what jumps me, I arrived here like pre-pandemic, and I think what we're seeing the numbers kind of go back to regular, leveling back out and coming back to what they were pre-pandemic. I always got very fascinated by the statistics during the pandemic. Traffic cases went way down, and civil disputes went way up. I'll let you figure out why that happened, but for the most part, but we're starting to see traffic cases kind of start to creep up. Civil filings this year has just been, we've been inundated. And the thing is, it's not just here in Northern Virginia, it's all across the state. A lot of my colleagues and I throughout the state at various conferences, we've all been noticing civil filings are just going up. One of the things I'd say is, though, that we do get a lot of state support also and they're making lots of headway and improving the way we're tracking, this and how we can handle it. And, so we're exploring, I'd say actually this was one of the positives that kind of came out for the state side of things, was it really kind of forced the state to look into our processes and procedures, and they've had to really kind of hit the update button a lot quicker than I think historically we have it as a state. And so like I just see that we're moving in the right direction, but it's going to be a iterative process.
Thank you.
Do you have anything?
I'll just add that I think a lot of, I think it trends also with the economy. And I mean, we had a lot of cuts with governmental cuts too. So you're going to see, the economy is down. I think you're going to see more, some eviction cases that are going to come into the court because of that. People just aren't able to pay their rent, for example. But I think the trend also is with the economy too.
Right. Thank you. It says a lot about the community when the court system is reliable and has a posture of being, expecting good, transparent, and timely service. And when people feel that they are well served by their court, it is a quality thing. And this is really perceived here by the general population for us. And I thank you for that. I know that's difficult to accomplish that. So
Thank you.
Well, thank you, Judge and Brian. I have no additional questions on what my colleagues have already stated. I'll just also lay out there that I realize that investing in staff, wanting to keep high quality talent in a place like Arlington requires significant investment outside of perhaps the norm, even when it comes to some of our state positions. Locales are different. I really hear you. And we're losing a lot of good folks across government because these state positions, they're a flat rate, but it's not enough, and these localities are having to pick up the delta there to help people just live. So thank you for what you do. This concludes, unless there's any other questions, thank you for your presentation today, and we're good.
Mr. Spain,
thank you.
Mr. Spain, could I ask one
Oh,
real
of
quick one?
course.
We can
Let's
carry
go.
it over later, but last year in the public safety work session, we had some discussion about the ASAP program. I think that's what it's called, the alcohol.
Safety Action.
Is there anything you could tell us about that and how it's working and how you wish it were working? Is it resourced enough? Is there anything, we can take it offline, but just wanted to tag that.
That's funded through the Sheriff's Department. They're, I guess, a department of the Sheriff's Department, the way I think the funding comes into them. We're very fortunate that our ASAP department is in our courthouse. So we have the facility there in the courthouse for them. And, I hate to bring up a terrible story, but there was a ASAP office that was not part of the courthouse, and they don't have the security system coming in, and someone was disgruntled and was involved in a homicide. One of the probation officers was killed because of it. So we're very lucky that we can keep our ASAP office in our courthouse. And also very fortunate that while it's there in our courthouse, someone comes out of my court having a DWI and they're referred to ASAP, they go directly to ASAP, and I will typically order them to go directly to ASAP once they leave court to enroll and get that intake appointment up afterwards. Tara Pollard-Smith is our ASAP director. She's done an excellent job with the program. We have ASAP policy board meetings quarterly where we meet and discuss new laws, other issues that may rise. So I think it's in good shape. I think it's doing well.
Super helpful. Thank you for the grace there.
Thank you, Your Honor. Thank you, Brian. Appreciate you.
And Mr. Henshaw is going to be the new chair of that ASAP?
Yeah. And that's the one thing I'm quickly
Possible.
learning about is Arlington County actually has kind of the dare I say, the benchmark for the ASAP programs and around the state. And I think a lot of it has to do with the level of support that they're receiving and everything. And the only other thing I wanted to add is if you're always welcome to come over, if you ever want to come over and see, walk through the courts, see what the clerk's office does. Voluntarily, yes, voluntarily, not as a group.
Okay, thank you very much. Appreciate it.
Thank you.
Okay, next we'll have Juvenile and Domestic Relations District Court presentation. And our plan, as the Juvenile and Domestic Relations District Court comes up, and their representatives will have about 15 minutes of presentation, followed by another 15 minutes of Q&A from the board.
She's not here. Oh, I'm sorry.
That's okay.
We're getting the placards out.
That's him.
I'm sorry. That's me.
I'd like to say that Earl Conklin, who's retiring May 7th, is that right? He came to me and he said the one thing he's going to miss the most is meeting with the county board. So I just wanted to put that out there.
Retirement celebration.
Okay, we're going to go ahead and get started, and Earl will, start with you down there with the director. Welcome, everyone. So we'll start with your presentation. We'll bring it up.
Thank you for allowing us to come talk about our budget and our work in JDR Court. Let me introduce Judge Michael Chick and Judge Robin Robb. They will have some comments, but before that, let me introduce the rest of the JDR team that is here. Yvette Zaragoza is our quality assurance person and does all of our data work, so we're very appreciative of her. Alex Espinoza-Smith is the one who takes our budget and turns it into purchases and contracts and other things. And then Rick Stroback is our deputy director for JDR. So with that, I'll turn it over to Judge Chick.
Okay.
So our court is check. Our court is a creature of statute. We were created by the Virginia Code, and we're a unique court in that it's the only court that has the specific purpose and intent that was written right into the Virginia Code, 16.1-227, and it says outright that our purpose is to try to do what we can do to preserve families, to try to do what we can do to divert kids from the system, and if we can't do that, to divert kids from within the system, and so we take that very seriously, and we go out of our way to try to do that, and a big part of that is the court services unit that we have, the programs that we have. And we have incredible people, and they help us strive to achieve that calling that the code puts upon us. And we are incredibly grateful for you all, for the board, for the constant support that you've given to us and to the county manager for that support over the years. I think that support was there long before I was a part of the court, and we certainly are grateful for it and very hopeful that it's going to continue on through the years. And I do want to say how grateful we are to Earl Conklin, because this is going to be his last budget session with you all. Earl has been serving the Juvenile Domestic Relations Court for, I think I'm getting this right, 36 years. And he started out in 1990 as the director of, I think the first director of the Aurora House program, where he did that for a number of years, and he became the court services director in 2012. And he's served in that role since then. So he has been an incredible blessing to the court. And, I could say from a personal perspective, as still a baby judge, he's been super helpful in helping to guide me through this very complicated work that we do. And so, Earl, I just want to say super grateful for you and everything you've done.
And we are very deeply grateful to the county board and to the county manager.
It was on, it was just not.
I cut
Okay.
you off, Judge.
That'll be your last time. No. All kidding aside, we wouldn't be able to meet the mandate of the statute for the work we do without the county manager and the county board, because a lot of what we do, besides trying to keep the kids out of the system and so forth, is to have programs available to them where they can connect with a trusted adult. Because a lot of kids don't have a trusted adult in their family. So the programs, the boys group home, the girls group home, after-school programs, the RISE mentoring program, which we cannot obviously order anybody into. It's a voluntary program. But by virtue of the fact that you funded the head of that has gone a long way to us being able to increase the mentoring program. So the kids do have this trusted adult, they have the connection, and they can then stay really out of our system. So those, same thing with the gang prevention. And we are also very deeply grateful for the assistance we're getting with the Safe Havens program. The numbers for that are quite substantial as far as the families that we serve, like over 531 actual participants in either the exchanges or the supervised visitation. And why that's important is because most of the families we're dealing with don't have the financial resources to be able to go and pay for private supervision. And private supervision is costing anywhere from $75 to $150 an hour. And so then you have kids, for whatever reason, if their families have domestic violence and so forth, aren't able to see a parent if we didn't have that program. And so we're serving quite a few people in that, and are grateful for any assistance we have in that.
I actually went out not that long ago to, I swapped with a judge in another jurisdiction because there was a conflict that they had out there with their whole bench, and so they needed to switch. And I'm sitting there and I'm hearing the case, and then I get to the point where I'm like, oh, well, this is a perfect case for, do you all have something like the Safe Havens program, or and they're looking at me like I have 3 heads and supervised visit, and it was a kind of a sobering reminder to me about how lucky we are here. So we are super. We consider it to be essential.
Thank you, judges. We'll move pretty quickly through these slides, if that's okay with you.
Yep.
Promoting safety in families and the community is a core part of our mission. We think we do that not by locking kids up, not by removing them from the community, but providing them great evidence-based services. That's what all of our programs, probation services, all of those things seek to do. So that's the best way to keep the community safe, we believe, in the long term. Next slide, please. There are 3 distinct core functions of JDR. There's the judges and the courtrooms and how they operate. Obviously, we have 2 judges and are currently going through courtroom renovations. I'll let the judges address that if they'd like at some point.
Well, no, because we told them last year at this meeting that we were hoping to be moved in by the summer. So we're hoping to be moved in by the summer.
So, and then the clerk of court has 6 deputy clerks. Currently, all the positions are filled. They're doing a great job. The new clerk, we love her very much. She has really brought some good resources to the system.
And she sends her regrets that she can't be here. She had a family obligation that she had to.
But as I think Judge Rucker mentioned, the supplement that is provided to the clerk's office is essential. The same factors, I'll just associate myself with his comments because that clerk has the same functions. In terms of the court service unit, which is the 3rd part, these are the programs and services that we offer out of the courthouse-based. Early diversion is our work with kids without entering them in any kind of state database. We do everything we can not to put their name anywhere or involve them in any formal way in the juvenile justice system. We serve a good number of kids there, 60 per year. Easily. And then our court intake and diversion. Intake is the process by which someone files a petition to initiate a court case. Our intake office did over 2,000 intakes last year in 2025. And then they also supervise our early offender program, which are the kids that often get put on a suspended imposition of sentence or something where a deferral of some kind where their case can be dismissed. And so we work with those first-time offenders to get their case dismissed, and they supervise about 80 of those at any given time. And then our juvenile probation and parole staff is obviously a core function. They have I think as of today, about 220 cases that they're supervising of kids that are under court supervision. Our detention diversion program and electronic monitoring has 20 kids at any given time that otherwise would be in the juvenile detention center. And so we supervise them very intensely, provide them support and coaching to comply with court expectations. And then our adult probation unit has 4 POs and a supervisor, and they serve at any given day. They've got about 280 cases that are under theirs. And those are primarily domestic violence related cases. And then we have a couple of behavioral health positions that provide support to our clients and clinical guidance to our staff and programs. And then we also have our community-based programs. Judge Robb has mentioned those. You're familiar with them. I think all of you have heard this number of times. But our group homes are important. They keep kids from being sent out of the community. They're community-based. Kids go to their home school. They're in proximity to their family. They get home passes on weekends. It's part of Arlington County and Falls Church. And the proximity to all of those things, which have been difficult for kids to manage in the past, is exactly where the work occurs to help them do better, to help them thrive, to change their reputations and peers, and all of those things happens because they remain here in Arlington. So that's the answer to why Arlington County operates those programs, is because it keeps kids at home. Our after-school programs, same thing. They work with kids every day after school and provide all kinds of resources and support and coaching to them and their parents. And then Safe Haven, I'm sorry,
Can I just
please.
interrupt you real quickly? The Girls Outreach Program. Girls Outreach Program is not just court-referred kids. The schools refer a lot of young ladies to the Girls Outreach Program, and that does tremendous work with keeping the young ladies invested and involved, and it's a real gift.
And then our RISE mentoring program, as the judges mentioned, you funded a position for that. Right as of today, we've got 20 active pairs of mentors. Kids, you see in the data, farther on other data, how many kids are actually being served and touched by that program. I will tell you, and I will tell anyone listening at home, we have 14 kids as of today who are waiting for a mentor. So if you know someone, the application process is online. We would welcome the support. And then our gang prevention services, again, those work with kids ideally prior to coming to court, prior to having a referral. They're referred to groups by the school. We do our soccer tournament. We do outreach to parents. There are lots of stories I could tell you about the successes of that program. So next slide is equity. We like to focus our equity. Most of the kids that come into contact with the juvenile justice system are kids of color, large majorities. We like to make sure that our diversion resources are available to the BIPOC population that we see in court. And so the question it answers is, who gets the benefit of diversion? Is it people that have privilege and opportunities anyway, or is it the kids who need the resources? So you can see the numbers there in FY25. Vast majority of the kids that receive diversion services through our department are kids of color. And I'll just mention, what you see there is early diversion, intake diversion, and detention diversion. Those are all points at which a decision's being made. So we're choosing diversion in those cases wherever we can. And then proposed changes, we've got the one-time funding for safe havens, which we are grateful to the manager for including in his recommended budget. We're looking for that grant application to come out from the Department of Justice. We'll apply. It has not yet been announced. It's usually announced in January, so we're not sure of the status of that. Funding for Aurora House, that's a utilization-based formula. The Falls Church reimbursements, also utilization-based, and some population-based of their access to our court services. And then there is one position being eliminated in the proposed budget, and that's the court psychologist, which we believe we can replace with contract-funded services for psychologicals when ordered by the court. In terms of the data, the next page you see, this is the data compiled by the clerk's office based on new cases that are coming into juvenile court. What I would point out to you is the increase from 22 to 25 in that last column shows what's driving. A lot of the discussion you've heard has been about increase in CSA costs. You've heard other things like that. I would say largely here's your reason. It is just the number of kids, the number of cases that we're seeing. 70% of our kids in juvenile court are Arlington youth, and they are eligible for all of those resources and services. I'd just like to mention here that a lot of the data and things you see here is about court services. This page is about our judges and our clerks. This is about what they see coming in. And those are the year-over-year increases. And what I'd say to you is a large number of those case types don't come to court services. They're adult probation, they're adult protective orders. They're child welfare cases for abuse and neglect. They're child custody and support and visitation. And all of those things are a heavy part of the court's workload. And what I would just say, which probably, I mean, being a judge is a prestigious job, I would just say that. But the judge in a juvenile court, in our juvenile court, comes at a cost. Our judges start court often at 8 a.m., and it's not uncommon for those cases to still be going after 5 p.m. This is solid court days. Our judges come in on the weekends to do orders, to get caught up on things when they can get caught up. There is a need for a third judge. They're talking to the state about that. There's a push for that. There's support for that. The workload demand is for that. So in addition to the workload, there's also those types of cases that I would mention. Sitting through a child abuse and neglect trial is traumatizing. Our judges and our clerk are human beings, and they feel it. Serious harm to an infant, making decisions that will affect the course of that child's life regarding their parents and their family. Those are complex things, and I just want to put on the radar what our judges do. So, and then the next page, our outputs. We're trying to track what we do that's successful. Number of youth served by our intake unit, you can see that's growing. These are successful cases. I'm sorry, these are our outputs. These are the number of unduplicated kids that are served by intake as a case. This is our early offender program I was talking about. The number of youth served by juvenile probation, again, you can see those climb. We did these numbers from 23 to 25 for that increase, so it kind of took the COVID piece out of it. And then the number of adults that we're serving, again, unduplicated. You can see those numbers continue to climb. And then our court services outcomes, our diversion success rates, those, we're thrilled. 92% of our diversions were successful in FY25. 90% of our youth on probation were successful in getting off probation, successfully meeting their goals during their term, and then 81% of our adults. So we've got some good staff who work very hard to produce those numbers. And then these are our community-based programs. You can see the numbers. I have a vignette I'd love to read to you about a girl who graduated from Girls Outreach this week and was released from probation. I don't think we have time unless you tell me you want to hear it. You want to hear it? Okay. I was hoping you'd say that. This girl was entered Girls Outreach in January of 25 with significant school, behavioral, family-related concerns, including chronic absences, failing grades, fighting, substance use, ongoing conflict with her peers and adults. She got court involved because of an assault and battery charge and a CHINS petition filed by her mom because she was running away. Girls Outreach established a good rapport with her. During the program, they helped her navigate CPS involvement. They domestic violence in the home situation, her mental health crisis, including being hospitalized and then on partial hospitalization services. Multiple systems were involved with her, as you can tell, through ongoing advocacy, crisis support, and collaboration with CPS, probation, DHS counseling, and the school system. GOP helped the girl to connect to individual therapy, in-home therapy, psychiatry, school supports, and Medicaid transportation. GOP supported the family in advocating for a school transfer because of safety concerns with other peers, and helped her adjust to the new school. The youth identified GOP, the groups they offer, as that helped her as being healthy relationships, thinking errors, relational aggression, and emotional regulation. Indicated those were especially helpful in improving her coping skills, accountability, conflict resolution, and sobriety. Since engaging in services, she's remained connected to therapy and psychiatry, joined the track and field team, attended the homework club, built healthier peer relationships, successfully completed probation, had her charge dismissed, and her case closed by the court. Both the youth and her mother reflect positively on the program's impact, with the youth sharing that GOP helped her stop running away from her problems, manage her anger in healthier ways, stay sober, and improve her attitude towards school. That girl graduated from the program this week and was released by the court this week. So I was meeting with the GOP counselor talking about the case. I asked her, would you just put that in writing so I could share it with you? Every one of our programs has a list of cases they can tell you just like that would have happened in the last year or who was released recently from the program. That's the work of our after school, our group home programs, and our RISE mentoring programs. Thank you for letting me share that. We are, I don't know, we're kind of downhill. We're going to detention. So, the good news here, you can see our projections for detention are going down. We work hard, our judges work hard, our alternatives work hard at providing an alternative to putting kids in secure detention. So you can see we're expecting fewer kids this year. Overall, last year I think we were here, we talked about how our kids were getting younger, they were getting more female, they were more likely to commit a felony, they were more likely to involve a weapon. We're doing better in all of those areas. I would say our numbers have leveled off. They're not climbing in 26 the way they did in 25. Fiscal year 25 was just a difficult year in terms of who and what we were seeing in juvenile court. So things are leveling off, especially the weapons charges. I would say that those have gone down significantly. I don't know what happened. We don't know what happened behind the scenes in 25 that kids were possessing so many weapons, but we're not seeing that in 26 at nearly the same rate as we were in 25. So that's the good news. We're not sure to what extent the cold weather and snow and ice and all those things kind of had an impact, but we'll take that, whatever it is. And then just lastly, budget considerations. You know, everything seems to be climbing in terms of the numbers overall, and that we know that the managers recommended safe havens in 27. We don't know what's going to happen beyond that. Just would keep that on the radar. With that, I think we'll take any questions you might have.
Well, thank you, Your Honors, and Earl. I think for this round, I'm going to start first, colleagues, and then I'm going to we'll close it out. And I just want to thank you for your work you're doing in this area. I'm going to ask the clerk to pull up page 323 of he's doing it right now. You're proposing an elimination of the senior court psychologist position. And I get the rationale that's laid out in the budget. But when I go to page, you're going to pull it up here in just a second. This kind of also goes back to DHS and some of the things they talked about. And I talked about to them investing in youth, investing, getting in front of things. When you go down, when we talk about these numbers, performance measures, and to your point, over the past couple of years, the number of youth served has doubled. And you kind of lay it out for us down in the number of youth served, the sub-bullet, where it says, the primary contributing factors are substance use and post-pandemic stressors, which have eroded mental health, general well-being, and positive social connections among youth. So with, contracting out psychologists and therapy, I hear you, but this position wasn't filled since February of 2025. And I understand we're going to move things around. Like, in this moment, given everything that's going on, why are we not looking to, I'm just wanting to understand that approach in removing a senior court psychologist when we know these youth, for example, need this level of service.
I understand your question. What I would say is the court psychologist at that professional position largely did psychological evaluations at the order of the court. So they would not necessarily designed to provide therapeutic services. Our court psychologist did do that when we needed her to, our last one. But the court psychologist per se is to do evaluations to guide the court in its disposition of cases, its sentencing on matters, its determination in, sometimes in child custody matters when there's concerns around mental health or substance use of one of the parties. So that's the function of the court psychologist, is evaluation, psychological evaluations.
Yeah.
We need behavioral health direct interventions, which is a different kind of position. It's a behavioral health position. We have one in court services now.
Yeah.
We have one at Argus House, and we have one vacant that we've combined to provide clinical support.
Duly noted, and we can talk offline, but I would have much rather, to your point you just made, see this position converted to something you need, right? Because you just stated we need, we can talk about this later. I just know there's a high demand for behavioral health specialists and many others as it relates to our youth. And to what I said in the last group with DHS again, if we don't get in front of this with our youth and these post-traumatic stress, post-pandemic, and everything else under the sun, societal ills and what's going on in our nation, I think it's just going to get worse. These numbers aren't going backward, they're going up. So with that, thank you, and let's continue to talk. Congratulations on a job well done over the past 40 years. I'm going to yield to my colleagues here as the lights are on. Let's go. Ms. Cunningham, your light is on, right?
It is. I didn't
Great,
think you were
okay.
going to call on me first, though.
We're shaking it up over here. Just changing it up a little
Keeping
bit.
us on our toes. If the clerk could show page 331. I think it tells the story that we've been talking about the whole time, which if you look at the red line there, that's the revenue, which presumably is mostly the state funding, which looks very, very flat. And then if you look at the expenses and the people to do even the 23-hour-a-day work that you're doing now, they are, of course, growing over time. So I just want to leave that with our community and perhaps with our legislatures in Richmond as well, that that's not sustainable, and we are patching over and over as a community, and it is costing our core services, other core services, to do that. So just wanted to highlight that. I know we all know that in this room, but I found that chart to be kind of compelling. I would say two things. One is we've done a lot of investment in our, to your point, Mr. Conklin, about how difficult this is and how traumatic it is for the adults involved in the court as well. With our public safety teams, we've been making great investments and great strides in wellness, therapy dogs, on-site wellness programs, peer programs. Are any of those sorts of things available to your teams, either locally or at the state level? And if not, that might be to the manager. Is there anything we could cross-populate a little bit? Because we need to take care of the grown-ups too.
The first thing that popped into my head when you asked that, when you said that, was that the sheriff's office has
Therapy dog.
They have their dogs, and I think Judge Rob and I both probably
could use
have them coming up all the time. Probably maybe selfishly for us sometimes, but honestly, a lot of times it's for the kids that that are coming, or those kinds of things. But I don't know. That was just the first thing that popped into my head with it. But
great.
I'm not sure if there's.
And then
anything else on those
healthcare
things.
your healthcare is through the state, right? You're not
It
on the
is,
county
yeah.
plans. And I would say for all of our employees, and especially our DHS and public safety employees.
Well, mine's for my wife, but
Yeah.
hers is probably through
There
the
you
state.
go. But, really all the staff have to put up with the 5 of us, so they needed a lot of support. I just wonder if there's anything we could cross-pollinate there without adding tons of expense, because yeah, the dogs are great, and sometimes additional support is needed. And then lastly, so excited to see the after-school program growth that we fought for last year. Last year, I remember that space was a constraint. Is that still the case? And if we are starting to open up space as we move our people around in leases that are longer, we do have some space in the inventory, or will soon. Is that helpful to you? And
Yes, that would be very helpful, I think, right now, certainly with Young Achievers program. They're housed jointly with Argus House, and that's not necessarily the most ideal setting.
Yeah.
I think Judge Chick and I have talked a lot about trying to see if we could move some of these after-school programs to expand them to a location in South Arlington, so that we're meeting needs of everybody in the community, because right now everybody is traveling up here to the courthouse area to participate in those programs. And if we could expand the programs and have a location in South Arlington, I think that would be great.
okay, great. So I think I see the manager writing this down for our CIP conversations, but it might be helpful to have a proposal from you of like what it would take from an operating perspective as well, and whether that's this year or it's the following year or it's a partner or something. I think we continue to have great needs for our young people, and if we can catch them earlier, let's do it. We know we have a program we know works.
Okay. Madam Vice Chair.
Thank you all for what you do. I really think that what JDR covers is some of the most important work that local government can be involved in, and we get to hang out in Project Peace, and same with Rick, and it is some of the work that I am most passionate about, and so grateful for you all being actively engaged and really looking beyond just the court services and really thinking about this as human services. And so first, just a thank you, and we're going to miss you, but we really appreciate the many, many years of work you've put in to build this program to be what it is today. A third judge does seem really reasonable and probably needed at this point, especially if the trajectory stays where it looks like it's likely to. How do we support you in asking the Commonwealth for that?
Well, we certainly have the support of the local delegation and so forth, but the Supreme Court is really looking at the numbers, and how they count numbers and how we count numbers are entirely different things. Because, for example, a child in need of supervision or services case, you get to count that for the adjudication and disposition. But these kids have significant needs, so we're doing multiple hearings for them, because we're not going to let a child just go by the way and say, oh, we've already done the adjudication, done the disposition, good luck to you. That's not how we operate, but that doesn't count for number purposes with the state. I'm not sure really how you can.
I mean, yeah, I mean, I think the biggest thing is to, I mean, we'll, it's probably more of an offline conversation, but when we're going to have those conversations with them, I think we'll certainly reach out to you all and sort of fill you in on what's going on, what we believe the numbers show, and to the extent that you're able to voice your thoughts on it, I'm sure that it would be super helpful. Yeah, I do think that there's some differences in the way that we handle our cases, like the way Judge Rob just said. But I also think if you look at the success rate of the kids that we have on supervision and on chins, I think you're going to see some different numbers there compared to maybe some other places that don't do it quite the same way. But we're super grateful for your passion for these things.
Of course, yeah, and whenever that does come up, please do let us know. A large amount of JDR relies upon also our volunteer involvement, whether it's the GALs and the CASAs or the RISE mentors, foster families, things like that. Do you feel like, that's not something captured really in budget, but it makes JDR world go round, basically? Do you feel like we are adequately bringing in that volunteer group to participate in a way that meets especially the increased caseload?
I think CASA seems to be doing a great job. I think they may have a little bit of a wait list right now with their program, but with respect to, well, and we say when we're talking about GALs and that sort of thing, they're not exactly volunteers. But they are volunteering. They're volunteering to be court appointed for these cases, and they get paid a very nominal fee. But I do think that we, Judge Rob and I, both have been trying to bump the numbers of people who are stepping up to do that kind of thing. And we're always reaching out to try to figure out who's available, who wants to learn, trying to match up this maybe young sort of budding attorney with somebody who's been doing this work for a long time to kind of learn the ropes and shadow them and get their GAL certification and that kind of thing. And there are some different events and that sort of thing that Judge Rob or I will go to. You probably go to those more than I do. To network, to try to get the folks connected to the court, I guess we'll say. But
Well, obviously, there's also the need for some more mentors, because if we have 14 young people on the wait list, obviously we'd like to have those folks not have to wait.
Yeah.
So anything that would assist in having more mentors.
And I feel like
is always
Arlington is
good.
filled with people who want to help. I mean, it's filled with people from all over the community, faith-based communities, different community organizations, and I mean, we have people that want to help. I think we just got to get the word out to people that we're here and that we would love to have their help with these kids.
Yeah. And then last question, I know we spend a lot of time talking about the court services for our youth involved in this area, but the number of adult cases is also on the rise, and we didn't talk a whole lot about that. Can you give a sense of what it is? What are the types of adult JDR cases that we're seeing more of? Is it just across the board, specific areas? And are there kind of programmatic investments that we should be thinking about making? I know we have partner shift in the DHS budget, but are there other programmatic things for adults that we should be thinking about?
I think, tell me if you think I'm wrong on this. I think most of the adult programs that we utilize, I believe, are run through DHS. I'm thinking about, like, of course, Partner Shift is one of them, the Fathers in Tech program. There are other sort of parenting programs, things like that we will have people go to, anger management, things like that. Most of those are run through DHS. I'm trying to think of one. I don't think other than our general.
Well, SCAN does a lot, with regard to the parenting classes and so forth, and there's a lot of need for that.
Yeah.
Because I think the adults that we're mostly seeing are for domestic violence cases.
With mental health and substance use, service
Co-occurring,
needs.
yeah.
So they rely heavily on DHS outpatient adult services. They get plugged into those frequently. And those are some of the including detox programs and residential.
If it's some kind of a crime involving, some kind of a sexual violence crime or something similar to that, there are psychosexual evaluations that are ordered and programs that people get ordered into for treatment on those things. But those are also not internal programs.
And there's some sort of a little bit of crossover too with General District Court, because a lot of times we'll have a contributing to the delinquency, but mine are up in juvenile court, but they've got the other charges down in General District Court. And there is some movement with some of the folks that have the mental health to kind of transfer our case or designate our cases down to General District Court in the hopes that the person would qualify for the behavioral health docket.
Yeah.
And so we do a lot of collegial discussions with our colleagues on the General District Court bench.
Great. Thank you.
Okay, we will go to Board Member Karen Tonis, followed by our chair, who would close us out, Mr. Chair. But I just want to make for the record, so it's known, Mr. Conklin, I think this senior court psychologist position, you have stated that you need more behavioral health experts. Is that what I'm seeing all heads?
Yes.
Thank you very much. Back to you, Mr. Karantonis.
Thank you, Mr. Spain. So to both our judges and Mr. Conklin, I have to preface that I cannot help it. I learned so much from you. My edification through your action, directly and indirectly, has been amazing. And actually, it helps me actually to have this conversation today, because Ms. Cunningham correctly pointed out that, the state funding curve is flat. I mean, flat as in dead. It doesn't even, it's not even a curve, right? It's a graph that doesn't even react to, I don't know, inflation or so. So nothing of the sort. While ours presents a delta that we adapt to something. And I would always say, it's not that this, as Judge Chick has had to discover, we are actually serving a different judicial and societal culture here. And this beams me back to 25, when part of these additions that account for this culture that is far friendlier, more humane, and it's centered on diversion and actual outcomes, was the RISE program, for example, was the investments in the diversion program. And here we are today, and I understand you just said the 25 was a weird, very pressurized year, and we reacted to that. We actually added an FTE back then, right? So are we well staffed for these? I recognize that, the needs are evolving. We are also successful. We learned a lot. So would you say today that we made the right decisions when, we followed also your advice to, start RISE, have mentoring programs, intensify our investment, also staff investment in DDP, the diversion program? Can we today say, yes, that was the right investment? If we haven't done that, we may have had a smaller delta to the dead graph of the state, but we wouldn't be better off, and we would have more juveniles in jail, and we would have worse outcomes in recidivism, et cetera.
I would say absolutely yes. I mean, I think that the RISE mentoring program is preventing kids from coming into the court system. It is giving them what they need prior to their conduct getting to the point where a referral to court has to happen. We see that all the time, and it's helping kids step down from, into the community. From, like, if they're we have kids, the May End Girls Outreach or one of our group homes, and transition to a mentor, and that's the support they have, and that keeps them from reoffending. It helps them succeed. I mean, I've got another great story of a girl that was in RISE who ended probation, and the judge referred her to RISE. Family deportation. She experienced all kinds of things, substance use, all court difficulty. But RISE was the transition to which she was. So she has had a mentor. That mentor has helped her get accepted into 3 colleges, helped her get her driver's license. We're talking about a grant for her to be able to take her drive behind the wheel class. Things like that are just. I mean, it's real life. That without that, they wouldn't have it. It gives hope. I mean, in essence, it gives hope to kids who otherwise may not have hope. So that, and our detention numbers are going down. because of our commitment to detention diversion.
Thank you.
And the way that you said that made me think of the Frederick Douglass quote that it's a lot easier to build strong children than it is to repair broken men, right? And I was thinking about some of these investments maybe you don't see the return now because some of these kids are they're younger, maybe they're in middle school, or maybe they're the younger brother or sister of I have a girl who is in the RISE mentoring program who she's going to be starting now. She was on supervision with me. She's going to be starting in a nursing program at an HBCU next year. And her little brother's still in the RISE program. He's never been court involved, but he goes to the program. And I didn't even know he was in the program, honestly. I went to it was like their Thanksgiving dinner, I think it was. And I bumped into her, and her brother was there. And it was just it was really, really nice, to see that. So.
Yeah, I was, this was kind of a rhetorical question because I wanted to just reflect on even the discussion about the third judge, et cetera, which is driven by not by quantities or by some sort of, objective wave of cases that we have to deal with. We do, but that's not the primary reason. The primary reason is that we have learned over time to focus on the quality of the deliverable, of the type of justice that we are delivering here, and we can measure and show the outcomes. While in other places when I visited Hanover County and even further down, they leave people behind. And they damage themselves in this. We can show something for the investment here. And actually, I think this is very positive, and you deserve a lot of credit for this. Thank you. And your entire team, because you led
It's the
that.
team.
Thank you, Mr. Karantonis. Mr. Spain seemed to indicate I could go next. I can't. What an extraordinary career. And I think everybody in the room and everybody who knows you knows that. And thank you. I would also give credit to colleagues for the great questions. I guess mindful of how busy the two of you are. And so do try to help us have that offline conversation to see about a third judge. And then I think Ms. Cunningham's point of a proposal for space, if you can bear to sit down for 20 minutes and just start typing and eventually send that to us, what I've been struck with over the years is that the work you're doing is inspiring. I have not felt yet in my 7 years on the board that I have delivered big, new, measurable change that the kids that you're serving need. I'm not saying, we're continuing to provide the supplement. We did the RISE. We've safe havens been up a few times, but I just wonder if there's a way that we as a board could find something measurable that could further contribute to the next steps, and that would be, seems to me, perhaps the most honorable way that we could actually honor you for your 36 plus years of work here. And I'm not asking you to do any more work on the way out. I'm just saying if you as judges could start the kernel of an idea, then we act. But if we just say we care about X, Y, or Z, it doesn't lead to the measurable benefit that we hope to provide. And I'll hope that we can take it offline and you can follow up with all of us if that's okay with both of you as judges.
Absolutely.
And with that, we're adjourned for today. Thank you.
Thank you for letting us go last.
Earl Conklin.
So we